Hey, Alpha Nurses. I'm Licensure from AlphaNurseGuy.com. This is 250 practice NCLEX questions. Without delay, let's get started.
A client newly diagnosed with tuberculosis is being admitted with a prescription for isolation precautions for tuberculosis. The nurse should assign the client to which type of room? 1. A room at the end of the hall for privacy. 2. A private room to implement airborne precautions. 3. A room near the nurse's station to ensure confidentiality. 4. A room with windows to allow sunlight. The correct answer is 1. Implementing airborne precautions for possible TB requires a private room assignment. In addition to isolating the client by using a private room, engineering controls can help prevent the spread of TB. A room at the end of the hall will aid in controlling airflow direction and can prevent contamination of air in adjacent areas. Confidentiality is provided for every client, regardless of the client's room location. Sunlight is not a component of isolation precautions. A client with chronic heart failure has atrial fibrillation and a left ventricular ejection fraction of 15%. The client is taking warfarin, Coumadin. The expected outcome of this drug is to 1. Decrease circulatory overload. 2. Improve the myocardial workload. 3. Prevent thrombus formation. 4. Regulate cardiac rhythm. The correct answer is 3. Coumadin is an anticoagulant, which is used in the treatment of atrial fibrillation and decreased left ventricular ejection fraction, less than 20%, to prevent thrombus formation and release of emboli into the circulation. The client may also take other medication as needed to manage the heart failure. Coumadin does not reduce circulatory load or improve myocardial workload. Coumadin does not affect cardiac rhythm. A client diagnosed with undifferentiated schizophrenia gained 50 pounds in 6 months while taking olanzapine. After seeing her psychiatrist, who changed the medication to ziprasidone, the client tells a nurse, "I don't want to take this ziprasidone either. I can't gain any more weight." Which response by the nurse is most appropriate for this client? 1. Ziprasidone causes less weight gain than the other atypical antipsychotics. 2. We can give it to you as an injection rather than in capsule form. 3. Abnormal movements are not as common with ziprasidone. 4. You can take it just before bedtime, so you won't need a snack. The correct answer is 1. Most clients experience less weight gain when taking ziprasidone. Although ziprasidone can be administered intramuscularly, it can be used only on an as-needed basis by this route. Ziprasidone has fewer extrapyramidal side effects, but that is not this client's major concern. Ziprasidone is better absorbed when taken with food, so a bedtime snack is needed. The nurse is reviewing the history and physical and physician prescriptions on a chart of a newly admitted client. The chart reads, 19-year-old reports a constant cough for the past few weeks with dark sputum for the past few days. Has night sweats, 10 pounds weight loss in past month, and always being tired. He took 1 Tylenol about an hour prior to arrival. BP is 120/64. Heart rate is 84 with regular rhythm. Respiration is 26, unlabored. Slight wheezing in right lower lobe posteriorly. Oxygen saturation is 92%. Temperature is 99.9 degrees Fahrenheit orally. Skin is warm and slightly diaphoretic. The patient has non-productive cough at this time. Nursing assessment reveals possible respiratory infection. The HCP orders chest X-ray, sputum specimen, and oxygen at 2 liters per nasal cannula. The nurse should first 1. Initiate airborne precautions. 2. Apply oxygen at 2 liters per nasal cannula. 3. Collect a sputum sample. 4. Reassess vital signs. The correct answer is 1. There is a high risk and potential for tuberculosis, and airborne precautions should be implemented immediately to prevent the spread of infection. After initiating precautions, the nurse can start the oxygen, check the vital signs, and collect the sputum specimen. The nurse should assess the client with left-sided heart failure, for which the following: select all that apply. 1. Dyspnea. 2. Jugular vein distension. 3. Crackles. 4. Right upper quadrant pain. 5. oliguria. 6. Decreased oxygen saturation levels. The correct answers are 1, 3, 5, and 6. Dyspnea, crackles, oliguria, and decreased oxygen saturation are signs and symptoms related to pulmonary congestion and inadequate tissue perfusion associated with left-sided heart failure. JVD and right upper quadrant pain, along with ascites and edema, are usually associated with congestion of the peripheral tissues and viscera in right-sided heart failure. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 79-year-old woman is brought to the outpatient clinic by her daughter for a routine medication evaluation. The daughter reports that her mother is quite stable and has no adverse effects from the risperidone she is taking. Then the daughter says, "I just think my mother could be even better if she was on a larger dosage. My son takes 1 milligram of Risperdal every day, and my mother is only on 0.5 milligrams. What is the most helpful response by the nurse? 1. Maybe your son is sicker than your mother is. 2. We can increase your mother's dosage if you want. 3. Older clients generally need only 1/3 to 1/2 the dose of younger people. 4. I'm not seeing any symptoms of illness in your mother. Let's wait until the next visit." The correct answer is 3. Elderly clients are typically on lower dosages of antipsychotic medications due to the metabolic changes of aging. Comparing dosages is not relevant. Each client is unique in metabolizing medications. Changing medication dosages is based on assessment of illness symptoms and the adverse effect profile, not on family preferences. Urging the daughter to wait discounts her concerns and gives no rationale for waiting. A client is receiving streptomycin for the treatment of tuberculosis. The nurse should assess the client for 8th cranial nerve damage by observing the client for 1. Vertigo, 2. Facial paralysis, 3. Impaired vision, 4. Difficulty swallowing. The correct answer is 1. The 8th cranial nerve is a vestibulocochlear nerve, which is responsible for hearing and equilibrium. Streptomycin can damage this nerve by ototoxicity. Symptoms of ototoxicity include vertigo, tinnitus, hearing loss, and ataxia. Facial paralysis would result from damage to the facial nerve. Impaired vision would result from damage to the optic, oculomotor, or the trochlear nerves. Difficulty swallowing would result from damage to the glossopharyngeal or the vagus nerve. An older adult with a history of heart failure is admitted to the emergency department with pulmonary edema. On admission, which of the following should the nurse assess first? 1. Blood pressure. 2. Skin breakdown. 3. Serum potassium level. 4. Urine output. The correct answer is 1. It is a priority to assess blood pressure first because people with pulmonary edema typically experience severe hypertension that requires early intervention. The client probably does not have skin breakdown, but when the client is stable and when the nurse obtains a complete health history, the nurse should inspect the client's skin for any signs of breakdown. However, when the client is stable, the nurse should inspect the skin. Potassium levels are not the first priority. The nurse should monitor urine output after the client is stable. A client diagnosed with schizophrenia is being switched to risperidone long-acting injection, which is Risperdal Consta. He is told that he will remain on his oral dose of risperidone daily for approximately 1 month. The client says, "I didn't have to take pills when I was on fluphenazine decanoate shots in the past." The nurse should tell the client, 1. Taking fluphenazine orally and by injection would not be as effective as the injection alone. 2. Risperdal Consta is less potent than fluphenazine decanoate. 3. The doctor didn't believe you would take both the pills and fluphenazine decanoate. 4. Risperdal Consta initially takes a little longer to reach the ideal blood level. The correct answer is 4. Achieving a therapeutic blood level is a slower process with risperidone long-acting injection. Oral flufenazine does not decrease the effectiveness of the intramuscular version and might increase the incidence of adverse effects. There is no evidence that the potency of the two medications is significantly different. Blaming the client for noncompliance with these two medications is inappropriate. The nurse should teach clients that the most common route of transmitting tubercle bacilli from person to person is through contaminated 1. Dust particles, 2. Droplet nuclei, 3. Water, 4. Eating utensils. The correct answer is 2. Tubercle bacilli are spread by airborne droplet nuclei. Droplet nuclei are the residue of evaporated droplets containing the bacilli, which remain suspended and are circulated in the air. Dust particles and water do not spread tubercle bacilli. Tuberculosis is not spread by eating utensils, dishes, or other fomites. Lasix, 40 milligrams intravenous push, is prescribed. Lasix 10 milligrams per 1 milliliter is available. The nurse should administer blank ml. The correct answer is 4 milliliters. The formula is desired amount divided by what is available, times quantity equals to amount to administer. 40 divided by 10 and multiplied by 1 equals to 4 milliliters. A client has been perceiving her roommate's stuffed animal as her own dog at home. The nurse determines that this misperception of reality illusion is improving when the client makes which of the following statements? 1. Jan's stuffed dog looks somewhat like my dog, Trixie. 2. Jan's dog and my dog could be twins. 3. I wish Jan hadn't had my dog stuffed. 4. I guess Jan needs a dog as much as I do. The correct answer is 1. Recognition by the client that there is a difference between the stuffed animal and her live dog indicates that the client perceives the reality of the situation. Stating that the stuffed animal and the client's dog could be twins reflects the client's continued misperception of reality. Thinking that the stuffed animal and her dog are one and the same. Stating that she wishes her dog hadn't been stuffed reflects her continued misperception of reality. Stating that the roommate needs a dog as much as she does is unrelated to the client's perception or misperception of reality. The client with tuberculosis is to be discharged home with community health nursing follow-up of the following nursing interventions, which should have the highest priority. 1. Offering the client emotional support. 2. Teaching the client about the disease and its treatment. 3. Coordinating various agency services. 4. Assessing the client's environment for sanitation. The correct answer is 2. Ensuring that the client is well educated about tuberculosis is the highest priority. Education of the client and family is essential to help the client understand the need for completing the prescribed drug therapy to cure the disease. Offering the client emotional support, coordinating various agency services, and assessing the environment may be part of the care for the client with tuberculosis. However, these interventions are of less importance than education about the disease process and its treatment. The major goal of nursing care for a client with heart failure and pulmonary edema is to 1. Increase cardiac output. 2. Improve respiratory status. 3. Decrease peripheral edema. 4. Enhance comfort. The correct answer is 1. Increasing cardiac output is the main goal of therapy for the client with heart failure or pulmonary edema. Pulmonary edema is an acute medical emergency requiring immediate intervention. Respiratory status and comfort will be improved when cardiac output increases to an acceptable level. Peripheral edema is not typically associated with pulmonary edema. When planning care for a client with schizophrenia who lacks motivation to shower and dress, which of the following outcomes should the nurse expect the client to achieve by the end of 4 days? 1. Verbalize the need to shower and dress herself. 2. Recognize the need to shower and dress herself. 3. Explain reasons for showering and dressing herself. 4. Perform showering and dressing for herself. The correct answer is 4. By the end of 4 days, the client should be able to perform showering and dressing for herself. The client with schizophrenia commonly appears to be apathetic and lack initiative. Therefore, demonstrating the ability to complete the tasks indicates improvement. Although the client may be able to recognize, verbalize, or explain the need to shower and dress herself, she may be unable to do so because of the ambivalence associated with schizophrenia that impedes the client's ability to initiate and complete self-care. Therefore, evidence of improvement would be lacking. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which of the following techniques for administering the MAN-2 test is correct? 1. Hold the needle and syringe almost parallel to the client's skin. 2. Pinch the skin when inserting the needle. 3. Aspirate before injecting the medication. 4. Massage the site after injecting the medication. The correct answer is 1. The MAN-2 test is administered via intradermal injection. The appropriate technique for an intradermal injection includes holding the needle and syringe almost parallel to the client's skin, keeping the skin slightly taut when the needle is inserted, and inserting the needle with the bevel side up. There is no need to aspirate, a technique that assesses for incorrect placement in a blood vessel when giving an intradermal injection. The injection site is not massaged. Furosemide is administered intravenously to a client with heart failure. How soon after administration should the nurse begin to see evidence of the drug's desired effect? 1. 5 to 10 minutes. 2. 30 to 60 minutes. 3. 2 to 4 hours. 4. 6 to 8 hours. The correct answer is 1. After intravenous injection of furosemide, diuresis normally begins at about 5 minutes and reaches its peak within about 30 minutes. Medication effects last 2 to 4 hours. When furosemide is given intramuscularly or orally, drug action begins more slowly and lasts longer than when it is given intravenously. The nurse reviews an arterial blood gas report for a client with chronic obstructive pulmonary disease. The results are pH 7.35, PCO2 62, PO 270, HCO3 34. The nurse should first 1. Apply a 100% non-rebreather mask. 2. Assess the vital signs. 3. Reposition the client. 4. Prepare for intubation. The correct answer is 2. Clients with chronic COPD have CO2 retention, and the respiratory drive is stimulated when the PO2 decreases. The heart rate, respiratory rate, and blood pressure should be evaluated to determine if the client is hemodynamically stable. Symptoms, such as dyspnea, should also be assessed. Oxygen supplementation, if indicated, should be titrated upward in small increments. There is no indication that the client is experiencing respiratory distress requiring intubation. Which of the following family members exposed to tuberculosis would be at highest risk for contracting the disease? 1. 45-year-old mother. 2. 17-year-old daughter. 3. 8-year-old son. 4. 76-year-old grandmother. The correct answer is 4. Elderly persons are believed to be at higher risk for contracting tuberculosis because of decreased immunocompetence. Other high-risk populations in the United States and Canada include the urban poor, clients with acquired immunodeficiency syndrome, and minority groups. The nurse should teach the client that signs of digoxin toxicity include which of the following? 1. Rash over the chest and back. 2. Increased appetite. 3. Visual disturbances, such as seeing yellow spots. 4. Elevated blood pressure. The correct answer is 3. Colored vision and seeing yellow spots are symptoms of digoxin toxicity. Abdominal pain, anorexia, nausea, and vomiting are other common symptoms of digoxin toxicity. Additional signs of toxicity include arrhythmias, such as atrial fibrillation or bradycardia. Rash, increased appetite, and elevated blood pressure are not associated with digoxin toxicity. The client with chronic obstructive pulmonary disease is taking theophylline. The nurse should instruct the client to report which of the following signs of theophylline toxicity. Select all that apply. 1. Nausea. 2. Vomiting. 3. seizures. 4. Insomnia. 5. Vision changes. The correct answers are 1, 2, 3, and 4. The therapeutic range for serum theophylline is 10 to 20 micrograms per milliliter. At higher levels, the client will experience signs of toxicity, such as nausea, vomiting, seizure, and insomnia. The nurse should instruct the client to report these signs and to keep appointments to have theophylline blood levels monitored. If the theophylline level is below the therapeutic range, the client may be at risk for more frequent exacerbations of the disease. A client has a positive reaction to the MAN-2 test. The nurse interprets this reaction to mean that the client has 1. Active tuberculosis. 2. Had contact with Mycobacterium tuberculosis. 3. Developed resistance to tubercle bacilli. 4. Developed passive immunity to tuberculosis. The correct answer is 2. A positive MAN-2 skin test indicates that the client has been exposed to tubercle bacilli. Exposure does not necessarily mean that active disease exists. A positive MAN-2 test does not mean that the client has developed resistance. Unless involved in treatment, the client may still develop active disease at any time. Immunity to tuberculosis is not possible. Which of the following foods should the nurse teach a client with heart failure to limit when following a 2-gram sodium diet? 1. Apples. 2. Tomato juice. 3. Whole wheat bread. 4. Beef tenderloin. The correct answer is 2. Canned foods and juices, such as tomato juice, are typically high in sodium and should be avoided in a sodium-restricted diet. Canned foods and juices in which sodium has been removed or limited are available. The client should be taught to read labels carefully. Apples and whole wheat breads are not high in sodium. Beef tenderloin would have less sodium than canned foods or tomato juice. Which of the following physical assessment findings are normal for a client with advanced chronic obstructive pulmonary disease? 1. Increased anteroposterior chest diameter. 2. Underdeveloped neck muscles. 3. Collapsed neck veins. 4. Increased chest excursions with respiration. The correct answer is 1. Increased anteroposterior chest diameter is characteristic of advanced COPD. Air is trapped in the overextended alveoli, and the ribs are fixed in an inspiratory position. The result is the typical barrel-chested appearance. Overly developed, not underdeveloped, neck muscles are associated with COPD because of their increased use in the work of breathing. Distended, not collapsed, neck veins are associated with COPD as a symptom of the heart failure that the client may experience secondary to the increased workload on the heart to pump blood into the pulmonary vasculature. Diminished, not increased, chest excursion is associated with COPD. The nurse should caution sexually active female clients taking isoniazid, INH, that the drug has which of the following effects? 1. Increases the risk of vaginal infection. 2. Has mutagenic effects on ova. 3. Decreases the effectiveness of hormonal contraceptives. 4. Inhibits ovulation. The correct answer is 3. INH interferes with the effectiveness of hormonal contraceptives, and female clients of childbearing age should be counseled to use an alternative form of birth control while taking the drug. INH does not increase the risk of vaginal infection, nor does it affect the ova or ovulation. When assessing an older adult, the nurse finds the apical impulse below the 5th intercostal space. The nurse should further assess the client for 1. Left atrial enlargement. 2. Left ventricular enlargement. 3. Right atrial enlargement. 4. Right ventricular enlargement. The correct answer is 2. A normal apical impulse is found over the apex of the heart and is typically located and auscultated in the left 5th intercostal space in the midclavicular line. An apical impulse located or auscultated below the 5th intercostal space or lateral to the midclavicular line may indicate left ventricular enlargement. Which of the following is an expected outcome of pursed lip breathing for clients with emphysema? 1. To promote oxygen intake. 2. To strengthen the diaphragm. 3. To strengthen the intercostal muscles. 4. to promote carbon dioxide elimination? The correct answer is 4. Pursed lip breathing prolongs exhalation and prevents air trapping in the alveoli, thereby promoting carbon dioxide elimination. By prolonging exhalation and helping the client relax, pursed lip breathing helps the client learn to control the rate and depth of respiration. Pursed lip breathing does not promote the intake of oxygen, strengthen the diaphragm, or strengthen intercostal muscles. The nurse should include which of the following instructions when developing a teaching plan for a client who is receiving isoniazid and rifampin for treatment of tuberculosis? 1. Take the medication with antacids. 2. Double the dosage if a drug dose is missed. 3. Increase intake of dairy products. 4. Limit alcohol intake. The correct answer is 4. Isoniazid and rifampin is a hepatotoxic drug. The client should be warned to limit intake of alcohol during drug therapy. The drug should be taken on an empty stomach. If antacids are needed for gastrointestinal distress, they should be taken 1 hour before or 2 hours after the drug is administered. The client should not double the dose of the drug because of potential toxicity. The client taking the drug should avoid foods that are rich in tyramine, such as cheese and dairy products, or he may develop hypertension. The nurse's discharge teaching plan for the client with heart failure should emphasize the importance of doing which of the following? 1. Maintaining a high-fiber diet. 2. Walking 2 miles every day. 3. Obtaining daily weights at the same time each day. 4. Remaining sedentary for most of the day. The correct answer is 3. Instructing the client to obtain daily weights at the same time each day is very important. The client should be told to call the physician if there has been a weight gain of 2 pounds or more. This may indicate fluid overload, and treatment can be prescribed early and on an outpatient basis, rather than waiting until the symptoms become life-threatening. Following a high-fiber diet is beneficial, but it is not relevant to the teaching needs of the client with heart failure. Prescribing an exercise program for the client, such as walking 2 miles every day, would not be appropriate at discharge. The client's exercise program would need to be planned in consultation with the physician and based on the history and the physical condition of the client. The client may require exercise tolerance testing before an exercise plan is laid out. Although the nurse does not prescribe an exercise program for the client, a sedentary lifestyle should not be recommended. A client arterial blood gas values are as follows: pH 7.31, PaO2 80 millimeters of mercury, PaCO2 65, HCO3 36 milliequivalents per liter. The nurse should assess the client for 1. Cyanosis, 2. Flushed skin, 3. Irritability, 4. Anxiety. The correct answer is 2. The high PaCO2 level causes flushing due to vasodilation. The client also becomes drowsy and lethargic because carbon dioxide has a depressant effect on the central nervous system. Cyanosis is a sign of hypoxia. Irritability and anxiety are not common with a PaCO2 level of 65, but are associated with hypoxia. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is providing follow-up care to a client with tuberculosis who does not regularly take the prescribed medication. Which nursing action would be most appropriate for this client? 1. Ask the client's spouse to supervise the daily administration of the medications. 2. Visit the client weekly to verify compliance with taking the medication. 3. Notify the physician of the client's noncompliance and request a different prescription. 4. Remind the client that tuberculosis can be fatal if it is not treated promptly. The correct answer is 1. Directly observed therapy can be implemented with clients who are not compliant with drug therapy. In DOT, a responsible person, who may be a family member or a healthcare provider, observes the client taking the medication. Visiting the client, changing the prescription, or threatening the client will not ensure compliance if the client will not or cannot follow prescribed treatment. An elderly client with diabetes who has been maintained on metformin glucophage has been scheduled for a cardiac catheterization. The nurse should verify that the physician has written a prescription to 1. Limit the amount of protein in the diet prior to the cardiac cath. 2. Withhold the glucophage prior to the cardiac catheterization. 3. Administer the glucophage with only a sip of water prior to the cardiac catheterization. 4. Give the glucophage before breakfast. The correct answer is 2. The nurse should verify that the physician has requested to withhold the glucophage prior to any procedure requiring dye, such as a cardiac catheterization, due to increased risk of lactic acidosis. Additionally, the drug will usually be withheld for up to 48 hours following a procedure involving dye, while it clears the client's system. The physician may prescribe sliding scale insulin during this time if needed. Regardless of how or when the medication is administered, the medication should be withheld. The amount of protein in the client's diet prior to the cardiac catheterization has no correlation with the medication or the test. The nurse teaches a client with chronic obstructive pulmonary disease to assess for signs and symptoms of right-sided heart failure. Which of the following signs and symptoms should be included in the teaching plan? 1. Clubbing of nail beds. 2. Hypertension. 3. Peripheral edema. 4. Increased appetite. The correct answer is 3. Right-sided heart failure is a complication of COPD that occurs because of pulmonary hypertension. Signs and symptoms of right-sided heart failure include peripheral edema, jugular venous distension, hepatomegaly, and weight gain due to increased fluid volume. Clubbing of nail beds is associated with conditions of chronic hypoxemia. Hypertension is associated with left-sided heart failure. Clients with heart failure have decreased appetites. A 4-year-old has been scheduled for a cardiac catheterization to help prepare the family. The nurse should 1. Advise the family to bring the child to the hospital for a tour a week in advance. 2. Explain that the child will need a large bandage after the procedure. 3. Discourage bringing favorite toys that might become associated with pain. 4. Explain that the child may get up as soon as the vital signs are stable. The correct answer is 2. The catheter insertion site will be covered with a bandage. This is important for preschool children to know, as they are very concerned about bodily harm. The best time to prepare a preschool child for an invasive procedure is the night before. Bringing a favorite toy to the hospital will help decrease the child's anxiety. To prevent bleeding, the child will be expected to keep the extremity straight for 4 to 6 hours after the procedure, either in bed or on the parent's lap. A client is scheduled for a cardiac catheterization. The nurse should do which of the following pre-procedure tasks? Select all that apply. 1. Administer all prescribed oral medications. 2. Check for iodine sensitivity. 3. Verify that written consent has been obtained. 4. Withhold food and oral fluids before the procedure. 5. Insert a urinary drainage catheter. The correct answers are 2, 3, and 4. For clients scheduled for a cardiac catheterization, it is important to assess for iodine sensitivity, verify written consent, and instruct the client to take nothing by mouth for 6 to 18 hours before the procedure. Oral medications are withheld unless specifically prescribed. A urinary drainage catheter is rarely required for this procedure. A client with chronic obstructive pulmonary disease is experiencing dyspnea and has a low PO2 level. The nurse plans to administer oxygen as prescribed. Which of the following statements is true concerning oxygen administration to a client with COPD? 1. High oxygen concentrations will cause coughing and dyspnea. 2. High oxygen concentrations may inhibit the hypoxic stimulus to breathe. 3. Increased oxygen use will cause the client to become dependent on the oxygen. 4. Administration of oxygen is contraindicated in clients who are using bronchodilators. The correct answer is 2. Clients who have a long history of COPD may retain carbon dioxide. Gradually, the body adjusts to the higher CO2 concentration, and high levels of CO2 no longer stimulate the respiratory center. The major respiratory stimulant then becomes hypoxemia. Administration of high concentrations of oxygen eliminates this respiratory stimulus and leads to hypoventilation. Oxygen can be drying if it is not humidified, but it does not cause coughing and dyspnea. Increased oxygen use will not create an oxygen dependency. Clients should receive oxygen as needed. Oxygen is not contraindicated with the use of bronchodilators. When developing the discharge teaching plan for the parents of a child who has undergone a cardiac catheterization for ventricular septal defect, which of the following should the nurse expect to include? 1. Restriction of the child activities for the next 3 weeks. 2. Use of sponge baths until the stitches are removed. 3. Use of prophylactic antibiotics before receiving any dental work. 4. Maintenance of a pressure dressing until return visit with a primary healthcare provider. The correct answer is 3. Prophylactic antibiotics are suggested for children with heart defects before dental work is done to reduce the risk of bacterial infection. Typically, activities are not restricted after cardiac catheterization. A percutaneous approach is used to insert the catheter, so stitches are not necessary. Showering or bathing is allowed as usual. The pressure dressing will be removed before the child is discharged. A client experiences initial indications of excitation after having an IV infusion of lidocaine hydrochloride started. The nurse should further assess the client when the client reports having 1. Palpitations, 2. Tinnitus, 3. Urinary frequency, 4. Lethargy. The correct answer is 2. Common adverse effects of lidocaine hydrochloride include dizziness, tinnitus, blurred vision, tremors, numbness and tingling of extremities, excessive perspiration, hypotension, seizures, and finally coma. Cardiac effects include slow conduction and cardiac arrest. Palpitations, urinary frequency, and lethargy are not considered typical adverse reactions to lidocaine. The nurse administers theophylline to a client. When evaluating the effectiveness of this medication, the nurse should assess the client for which of the following: 1. Suppression of the client's respiratory infection. 2. Decrease in bronchial secretions. 3. Less difficulty breathing. 4. Thinning of tenacious, purulent sputum. The correct answer is 3. Theophylline is a bronchodilator that is administered to relax airways and decrease dyspnea. Theophylline is not used to treat infections and does not decrease or thin secretions. An 18-month-old with congenital heart defect is to receive digoxin twice a day. The nurse should instruct the parents about which of the following? 1. Digoxin enables the heart to pump more effectively with a slower and more regular rhythm. 2. Signs of toxicity include loss of appetite, vomiting, increased pulse, and visual disturbances. 3. Digoxin is absorbed better if taken with meals. 4. If the child vomits within 15 minutes of administration, the dosage should be repeated. The correct answer is 1. Digoxin's effect is to slow the rate of the electrical conduction to the heart and increase the strength of the heart's contraction. Signs of toxicity include anorexia and decreased heart rate. Digoxin should be taken 1 hour before meals or 2 hours after meals in order to obtain better absorption of the drug. If the child vomits within 15 minutes of administration, the dose should not be repeated because it is not known how much of the medication has been absorbed. A client has mitral stenosis and will have a valve replacement. The nurse is instructing the client about health maintenance prior to surgery. Inability to follow which of the following regimens would pose the greatest health hazard to this client at this time? 1. Medication therapy. 2. Diet modification. 3. Activity restrictions. 4. Dental care. The correct answer is 1. Preoperatively, anticoagulants may be prescribed for client with advanced valvular heart disease to prevent emboli. Postoperatively, all clients with mechanical valves and some clients with bioprosthesis are maintained indefinitely on anticoagulant therapy. Adhering strictly to a dosage schedule and observing specific precautions are necessary to prevent hemorrhage or thromboembolism. Some clients are maintained on lifelong antibiotic prophylaxis to prevent recurrence of rheumatic fever. Episodic prophylaxis is required to prevent infective endocarditis after dental procedures or upper respiratory, gastrointestinal, or genitourinary tract surgery. Diet modification, activity restrictions, and dental care are important. However, they do not have as much significance postoperatively as medication therapy does. A client uses a metered dose inhaler to aid in management of asthma, which action indicates to the nurse that the client needs further instruction regarding its use. Select all that apply. 1. Activation of the MDI is not coordinated with inspiration. 2. The client inspires rapidly when using the MDI. 3. The client holds his breath for 3 seconds after inhaling with the MDI. 4. The client shakes the MDI after use. 5. The client performs puffs in rapid succession. The correct answers are 1, 2, 3, 4, and 5. Utilization of an MDI requires coordination between activation and inspiration. Deep breaths to ensure that medication is distributed into the lungs, holding the breath for 10 seconds or as long as possible to disperse the medication into the lungs, shaking up the medication in the MDI before use, and a sufficient amount of time between puffs to provide an adequate amount of inhalation medication. A child diagnosed with tetralogy of Fallot becomes upset, crying and thrashing around when a blood specimen is obtained. The child's color becomes blue, and the respiratory rate increases to 44 breaths per minute. Which of the following actions should the nurse do first? 1. Obtain a prescription for sedation for the child. 2. Assess for an irregular heart rate and rhythm. 3. Explain to the child that it will only hurt for a short time. 4. Place the child in a kneaded chest position. The correct answer is 4. The child is experiencing a hypercyanotic or hypoxic episode. Therefore, the nurse should place the child in a kneaded chest position. Flexing the legs reduces venous flow of blood from the lower extremities and reduces the volume of blood being shunted to the interventricular septal defect and the overriding aorta in the child with tetralogy of Fallot. As a result, the blood then entering the systemic circulation has higher oxygen content, and dyspnea is reduced. Flexing the legs also increases vascular resistance and pressure in the left ventricle. An infant often assumes a kneaded chest position in the crib, or the mother learns to put the infant over her shoulder while holding the child in a knee to chest position to relieve dyspnea. If this position is ineffective, then the child may need a sedative. Once the child is in the position, the nurse may assess for an irregular heart rate and rhythm, explaining to the child that it will only hurt for a short time does nothing to alleviate the hypoxia. A client who has undergone a mitral valve replacement has persistent bleeding from the sternal incision during the early postoperative period. The nurse should do which of the following? Select all that apply. 1. Administer warfarin. 2. Check the postoperative CBC, INR, PTT, and platelet levels. 3. Confirm availability of blood products. 4. Monitor the mediastinal chest tube drainage. 5. Start a dopamine drip for a systolic BP less than 100. The correct answers are 2, 3, and 4. The hemoglobin and hematocrit should be assessed to evaluate blood loss. An elevated INR and PTT and decreased platelet count increase the risk for bleeding. The client may require blood product depending on lab values and severity of bleeding. Therefore, availability of blood products should be confirmed by calling the blood bank. Close monitoring of blood loss from the mediastinal chest tubes should be done. Warfarin is an anticoagulant that will increase bleeding. Anticoagulation should be held at this time. Information is needed on the type of valve replacement. For mechanical heart valve, the INR is kept at 2 to 3.5. Tissue valves do not require anticoagulation. Dopamine should not be initiated if the client is hypotensive from hypovolemia. Fluid volume assessment should always be done first. Volume replacement should be initiated in a hypovolemic client prior to starting an inotrope, such as dopamine. A client experiencing a severe asthma attack has the following arterial blood gas results: pH 7.33, PCO2, 48 PO2, 58 HCO3, 26. Which of the following prescriptions should the nurse perform first? 1. Albuterol nebulizer. 2. chest x-ray. 3. Ipratropium inhaler. 4. Sputum culture. The correct answer is 1. The arterial blood gas reveals a respiratory acidosis with hypoxia. A quick-acting bronchodilator, albuterol, should be administered via nebulizer to improve gas exchange. Ipratropium is a maintenance treatment for bronchospasm that can be used with albuterol. A chest X-ray and sputum sample can be obtained once the client is stable. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When assessing a child after heart surgery to correct tetralogy of Fallot, which of the following should alert the nurse to suspect a low cardiac output? 1. Bounding pulses and mottled skin. 2. Altered level of consciousness and thready pulse. 3. Capillary refill of 2 seconds and blood pressure of 96/67. 4. Extremities warm to the touch and pale skin. The correct answer is 2. With a low cardiac output and subsequent poor tissue perfusion, signs and symptoms would include pale, cool extremities, cyanosis, weak, thready pulses, delayed capillary refill, and decrease in level of consciousness. For a client who excretes excessive amounts of calcium during the postoperative period after open heart surgery, which of the following measures should the nurse institute to help prevent complications associated with excessive calcium excretion? 1. Ensure a liberal fluid intake. 2. Provide an alkaline ash diet. 3. Prevent constipation. 4. Enrich the client's diet with dairy products. The correct answer is 1. In an immobilized client, calcium leaves the bone and concentrates in the extracellular fluid. When a large amount of calcium passes through the kidneys, calcium can precipitate and form calculi. Nursing interventions that help prevent calculi include ensuring a liberal fluid intake, unless contraindicated. A diet rich in acid should be provided to keep the urine acidic, which increases the solubility of calcium. Preventing constipation is not associated with excessive calcium excretion. Limiting foods rich in calcium, such as dairy products, will help in preventing renal calculi. The nurse is teaching the client how to use a metered-dose inhaler to administer a corticosteroid. Which of the following indicates that the client is using the MDI correctly? Select all that apply. 1. The inhaler is held upright. 2. The head is tilted down while inhaling the medicine. 3. The client waits 5 minutes between puffs. 4. The client rinses the mouth with water following administration. 5. The client lies supine for 15 minutes following administration. The correct answers are 1 and 4. The client should shake the inhaler and hold it upright when administering the drug. The head should be tilted back slightly. The client should wait about 1 to 2 minutes between puffs. The mouth should be rinsed following the use of a corticosteroid MDI to decrease the likelihood of developing an oral infection. The client does not need to lie supine. Instead, the client will likely to be able to breathe more freely if sitting upright. An infant weighing 9 kilograms is in the pediatric intensive care unit following arterial switch surgery. In the past hour, the infant has had 16 milliliters of urine output. Which action should the nurse take? 1. Notify the primary healthcare provider immediately. 2. Record the urine output in the chart. 3. Administer a fluid bolus immediately. 4. Assess for other signs of hypervolemia. The correct answer is 2. Urine output for an infant weighing 9 kilograms should be 1 milliliter per kilogram per hour. 16 milliliters of urine output is more than adequate for 1 hour, so the nurse should record the output in the chart. There is no reason to notify the primary health care provider regarding adequate urine output. The infant has adequate output, so there is no need for a fluid bolus. A fluid bolus could also cause the infant to become fluid overloaded, increasing the workload on the heart. There is no information in the question indicating that the child is hypervolemic. Good dental care is an important measure in reducing the risk of endocarditis. A teaching plan to promote good dental care in a client with mitral stenosis should include instructing the client to do which of the following? Select all that apply. 1. Brush the teeth at least twice a day. 2. Avoid use of an electric toothbrush. 3. Take an antibiotic prior to oral surgery. 4. Floss the teeth at least once a day. 5. Have regular dental checkups. 6. Rinse the mouth with an antibiotic mouthwash once a day. The correct answers are 1, 4, and 5. Daily dental care, including brushing the teeth twice a day and flossing once a day, and frequent checkups by a dentist who is informed about the client's condition, are required to maintain good oral health. The client can use a regular toothbrush. It is not necessary to avoid use of an electric toothbrush. Taking antibiotics prior to certain dental procedures is recommended only if the client has a prosthetic valve or heart transplant. It is not necessary to use an antibiotic mouthwash. A client who has been taking flunisolide nasal spray, 2 inhalations a day, for treatment of asthma has painful, white patches in the mouth. Which response by the nurse would be most appropriate? 1. This is an anticipated adverse effect of your medication. It should go away in a couple of weeks. 2. You're using your inhaler too much and it has irritated your mouth. 3. You have developed a fungal infection from your medication. It will need to be treated with an antifungal agent. 4. Be sure to brush your teeth and floss daily. Good oral hygiene will treat this problem. The correct answer is 3. Use of oral inhalant corticosteroids, such as flunisolide, can lead to the development of oral thrush, a fungal infection. Once developed, thrush must be treated by antifungal therapy. It will not resolve on its own. Fungal infections can develop even without overuse of the corticosteroid inhaler. Although good oral hygiene can help prevent development of a fungal infection, it cannot be used alone to treat the problem. As part of the preoperative teaching for the family of a child undergoing a tetralogy of phallic repair, the nurse tells the family upon returning to the pediatric floor that the child may 1. Be placed on a reduced sodium diet. 2. Have an activity restriction for several days. 3. Be assigned to an isolation room. 4. Have visits limited to a select few. The correct answer is 1. Because of the hemodynamic changes that occur with open heart surgery repair, particularly with septal defects, transient congestive heart failure may develop. Therefore, the child's sodium intake typically is restricted to 2 to 3 grams per day. Activity restrictions are inappropriate. Typically, the child is encouraged to walk the halls and unit. Risk for infection after the repair is the same as any postoperative client. Therefore, isolation is not necessary. The child may be placed in a room with other children who are not contagious. Visitors are not restricted unless the pediatric unit has restrictive visiting policies. 3 days after mitral valve replacement surgery, the client tells a nurse there is a clicking noise coming from the chest incision, and the incision seems to be becoming larger. The nurse's response should reflect the understanding that the client may be experiencing which of the following? 1. Anxiety related to altered body image. 2. Anxiety related to altered health status. 3. Altered tissue perfusion. 4. Lack of knowledge regarding the postoperative course. The correct answer is 1. Verbalized concerns from this client may stem from anxiety over the changes in the body after open heart surgery. Although the client may experience anxiety related to altered health status or may have a lack of knowledge regarding the postoperative course, the client is pointing out the changes in the body image. The client is not concerned about altered tissue perfusion. Which of the following is an expected outcome for an adult client with well-controlled asthma? 1. Chest X-ray demonstrates minimal hyperinflation. 2. Temperature remains lower than 100 degrees Fahrenheit. 3. Arterial blood gas analysis demonstrates a decrease in PO2. 4. Breath sounds are clear. The correct answer is 4. Between attacks, breath sounds should be clear on auscultation with good airflow present throughout lung fields. Chest X-rays should be normal. The client should remain afebrile. Arterial blood gases should be normal. The mother of a child hospitalized with tetralogy tells the nurse that the child's 3-year-old sibling has become quiet and shy and demonstrates more than a usual amount of genital curiosity since this child's hospitalization. The nurse should tell the mother, 1. This behavior is very typical for a 3-year-old. 2. This may be how your child expresses feeling a need for attention. 3. This may be an indication that your child might feel responsible. 4. This may be a sign of depression in your child. The correct answer is 2. According to Erickson, the central psychosocial task of a preschooler is to develop a sense of industry versus guilt. Any environmental situation may affect the child. In this situation, the sibling is probably feeling less attention from the mother and trying to resolve the conflict in an inappropriate way. 3-year-olds are usually active and outgoing. These behaviors represent a change. Symptoms of depression would include withdrawal and fatigue. A client who has had a total laryngectomy appears withdrawn and depressed. The client keeps the curtain drawn, refuses visitors, and indicates a desire to be left alone. Which nursing intervention would most likely be therapeutic for the client? 1. Discussing behavior with the spouse to determine the cause. 2. Exploring future plans. 3. Respecting the need for privacy. 4. Encouraging expression of feelings nonverbally and in writing. The correct answer is 4. The client has undergone body changes and permanent loss of verbal communication. He may feel isolated and insecure. The nurse can encourage him to express his feelings and use this information to develop an appropriate plan of care. Discussing the client behavior with his wife may not reveal his feelings. Exploring future plans is not appropriate at this time because more information about the client's behavior is needed before proceeding to this level. The nurse can respect the client's need for privacy while also encouraging him to express his feelings. The nurse should teach the client with asthma that which of the following is one of the most common precipitating factors of an acute asthma attack. 1. Occupational exposure to toxins. 2. Viral respiratory infections. 3. Exposure to cigarette smoke. 4. Exercising in cold temperatures. The correct answer is 2. The most common precipitator of asthma attacks is viral respiratory infection. Clients with asthma should avoid people who have the flu or a cold and should get yearly flu vaccinations. Environmental exposure to toxins or heavy particulate matter can trigger asthma attacks. However, far fewer asthmatics are exposed to such toxins than are exposed to viruses. Cigarette smoke can also trigger asthma attacks, but to a lesser extent than viral respiratory infections. Some asthmatic attacks are triggered by exercising in cold weather. A 32-year-old multigravida returns to the clinic for a routine prenatal visit at 36 weeks gestation. The assessments during this visit include BP 140 over 90, pulse 80, and +2 edema of the ankles and feet. What further information should the nurse obtain to determine if this client is becoming preeclamptic? 1. Headaches. 2. Blood glucose level. 3. Proteinuria. 4. Edema in lower extremities. The correct answer is 3. The two major defining characteristics of preeclampsia are blood pressure elevation of 140 over 90 or greater and proteinuria. Because the client's blood pressure meets the gestational hypertension criteria, the next nursing responsibility is to determine if she has protein in her urine. If she does not, then she may be having transient hypertension. The edema is within normal limits for someone at this gestational age, particularly because it is in the lower extremities. The preeclamptic client will have significant edema in the face and hands. Headaches are significant in pregnancy-induced hypertension, but may have other etiologies. The client's blood glucose level has no bearing on a preeclampsia diagnosis. When suctioning a tracheostomy tube 3 days following insertion, the nurse should follow which of the following procedures? 1. Use a sterile catheter each time the client is suctioned. 2. Clean the catheter in sterile water after each use and reuse for no longer than 8 hours. 3. Protect the catheter in sterile packaging between suctioning episodes. 4. Use a clean catheter with each suctioning and disinfect it in hydrogen peroxide between uses. The correct answer is 1. The recommended technique is to use a sterile catheter each time the client is suctioned. There is a danger of introducing organisms into the respiratory tract when strict aseptic technique is not used. Reusing a suction catheter is not consistent with aseptic technique. The nurse does not use a clean catheter when suctioning a tracheostomy or a laryngectomy. It is a sterile procedure. A client diagnosed with asthma has been prescribed fluticasone 1 puff every 12 hours per inhaler. Place in correct order the statements the nurse would use when teaching the client how to properly use the inhaler with a spacer. 1. Hold your breath for at least 10 seconds, then breathe in and out slowly. 2. Take off the cap and shake the inhaler. 3. Rinse your mouth. 4. Breathe out all of your air. Hold the mouthpiece of your inhaler and spacer between your teeth with your lips closed around it. 5. Press down on the inhaler once and breathe in slowly. 6. Attach the spacer. The correct order is 2, 6, 4, 5, 1, and 3. Using a spacer, especially with an inhaled corticosteroid, can make it easier for medication to reach the lungs. It can also prevent excess medication remaining in the mouth and throat, where it can lead to minor irritation. It is important for the client to empty the lungs, breathe in slowly, and hold breath in order to draw as much medication into the lungs as possible. Rinsing after using a corticosteroid inhaler may help prevent irritation and infection. Rinsing will also reduce the amount of drug swallowed and absorbed systemically. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 29-year-old multigravida at 37 weeks gestation is being treated for severe preeclampsia and has magnesium sulfate infusing at 3 grams per hour. To maintain safety for this client, the priority intervention is to 1. Maintain continuous fetal monitoring. 2. Encourage family members to remain at bedside. 3. Assess reflexes, clonus, visual disturbances, and headache. 4. Monitor maternal liver studies every 4 hours. The correct answer is 3. The central nervous system functioning and freedom from injury is a priority in maintaining well-being of the maternal fetal unit. If the mother suffers CNS damage related to hypertension or stroke, oxygenation status is compromised and the well-being of both mother and infant are at risk. Continuous fetal monitoring is an assessment strategy for the infant only and would be of secondary importance to maternal CNS assessment because maternal oxygenation will dictate fetal oxygenation and well-being. In preeclampsia, frequent assessment of maternal reflexes, clonus, visual disturbances, and headache give clear evidence of the condition of the maternal CNS system. Monitoring the liver studies does give an indication of the status of the maternal system, but the less invasive and highly correlated condition of the maternal CNS system in assessing reflexes, maternal headache, visual disturbances, and clonus is the highest priority. Psychosocial care is a priority and can be accomplished in ways other than having the family remain at the bedside. The nurse is making rounds and observes a client who had a tracheostomy tube inserted 2 days ago. See figure below. The nursing policy manual recommends use of the gauze pad. The nurse should 1. Make sure the gauze pad is dry and the client is in a comfortable position. 2. Reposition the gauze pad around the stoma with the open end downward. 3. Ask a registered nurse to change the ties and position another gauze pad around the stoma. 4. Ask the nursing assistant to tie the tracheostomy tube ties in the back of the client's neck. The correct answer is 1. The tracheostomy tube, ties, and gauze pad are positioned correctly. The nurse should be sure the client is comfortable. The tracheostomy tube ties should be tied in a square knot on the side of the neck and alternate sides of the neck when the ties are changed. The full part of the gauze square should be placed under the tracheostomy tube to absorb drainage. There is no indication the ties need to be changed. An additional gauze pad is not necessary. If necessary, the current gauze square should be changed rather than add an additional pad. A nurse is planning care for a 12-year-old with rheumatic fever. The nurse should teach the parents to 1. Observe the child closely. 2. Allow the child to participate in activities that will not tire him. 3. Provide for adequate periods of rest between activities. 4. Encourage someone in the family to be with the child 24 hours a day. The correct answer is 3. The nurse should teach the parents to provide for sufficient periods of rest to decrease the client's cardiac workload. The client's condition does not warrant close observation unless cardiac complications develop. The child's activity level will be based on the results of the sedimentation rate, C-reactive protein, heart rate, and cardiac function. The family does not need to be with the client 24 hours a day unless carditis develops and his condition deteriorates. After instructing a premigravida client at 38 weeks gestation about how preeclampsia can affect the client and the growing fetus, the nurse realizes that the client needs additional instruction when she says that preeclampsia can lead to which of the following? 1. Hydrocephalic infant. 2. Abruptio placentae. 3. Intrauterine growth restriction. 4. Poor placental perfusion. The correct answer is 1. Congenital anomalies such as hydrocephalus are not associated with preeclampsia. Conditions such as stillbirth, prematurity, abruptio placentae, intrauterine growth restriction, and poor placental perfusion are associated with preeclampsia. Abruptio placentae occurs because of severe vasoconstriction. Intrauterine growth restriction is possible owing to poor placental perfusion. Poor placental perfusion results from increased vasoconstriction. A client has had hoarseness for more than 2 weeks. The nurse should 1. Refer the client to a healthcare provider for a prescription for an antibiotic. 2. Instruct the client to gargle with salt water at home. 3. Assess the client for dysphagia. 4. Instruct the client to take a throat analgesic. The correct answer is 3. Hoarseness occurring longer than 2 weeks is a warning sign of laryngeal cancer. The nurse should first assess other signs, such as a lump in the neck or throat, persistent sore throat or cough, earache, pain, and difficulty swallowing. Gargling with salt water may lead to increased irritation. There is no indication of infection warranting an antibiotic. An oral analgesic will provide only temporary relief of discomfort if hoarseness is accompanied by a sore throat. Which of the following outcomes indicates that the activity restriction necessary for a 7-year-old child with rheumatic fever during the acute phase has been effective? 1. Joints demonstrate absence of permanent injury. 2. The resting heart rate is between 60 and 100 beats per minute. 3. The child exhibits a decrease in chorea movements. 4. The subcutaneous nodules over the joints are no longer palpable. The correct answer is 2. During the acute phase of rheumatic fever, the heart is inflamed and every effort is made to reduce the work of the heart. Bed rest with limited activity is necessary to prevent heart failure. Therefore, the most reliable indicator that activity restriction has been effective is a resting heart rate between 60 and 100 beats per minute, normal for a 7-year-old child. No permanent damage to the joints occurs with rheumatic fever. The chorea movements associated with rheumatic fever are self-limited and usually disappear in 1 to 3 months. They are unrelated to activity restrictions. Subcutaneous nodules that occur over joint surfaces also resolve over time with no treatment. Therefore, they are not appropriate for evaluating the effectiveness of activity restrictions. When teaching a multigravida client diagnosed with mild preeclampsia about nutritional needs, which of the following types of diet should the nurse discuss? 1. High residue diet. 2. Low sodium diet. 3. Regular diet. 4. High protein diet. The correct answer is 3. For clients with mild preeclampsia, a regular diet with ample protein and calories is recommended. If the client experiences constipation, she should increase the fiber in her diet, such as by eating raw fruits and vegetables and increase fluid intake. A high residue diet is not a nutritional need in preeclampsia. Sodium and fluid intake should not be restricted or increased. A high-protein diet is unnecessary. Which of the following is an expected outcome for a client recovering from a total laryngectomy? The client will 1. Regain the ability to taste and smell food. 2. Demonstrate appropriate care of the gastrostomy tube. 3. Communicate feelings about body image changes. 4. Demonstrate sterile suctioning technique for stomach care. The correct answer is 3. It is important that the client be able to communicate his or her feelings about the body image changes that have occurred as a result of surgery. Open communication helps promote adjustment. The client may not regain the ability to taste and smell food because of no longer breathing through the nose, or because of radiation therapy treatments, or both. A gastrostomy tube would not typically be placed after a total laryngectomy, nor would it be necessary for client to demonstrate sterile suctioning technique for stomach care. The client would use clean technique. The primary health care provider prescribes pulse assessments through the night for a 12-year-old child with rheumatic fever who has a daytime heart rate of 120. The nurse explains to the mother that this is to evaluate if the elevated heart rate is caused by 1. The morning digitalis. 2. Normal activity during waking hours. 3. A warmer daytime environment. 4. Normal variations in day and evening hours. The correct answer is 2. An above-average pulse rate that is out of proportion to the degree of activity is an early sign of heart failure in a client with rheumatic fever. The sleeping pulse is used to determine whether the mild tachycardia persists during sleep or whether it is a result of daytime activities. The environmental temperature would need to be quite warmer before it could influence the heart rate. Digitalis lowers the heart rate, so the rate would be decreased during the daytime. A preemie-gravida client at 38 weeks gestation diagnosed with mild preeclampsia calls the clinic nurse to say she has a continuous headache for the past 2 days accompanied by nausea. The client does not want to take aspirin. The nurse should tell the client, 1. Take 2 acetaminophen tablets. They aren't as likely to upset your stomach. 2. I think the doctor should see you today. Can you come to the clinic this morning? 3. You need to lie down and rest. Have you tried placing a cool compress over your head? 4. I'll ask the doctor to call in a prescription for aspirin with codeine. What's your pharmacy's number? The correct answer is 2. A client with preeclampsia and a continuous headache for 2 days should be seen by a healthcare provider immediately. Continuous headache, drowsiness, and mental confusion indicate poor cerebral perfusion and are symptoms of severe preeclampsia. Immediate care is recommended because these symptoms may lead to eclampsia or seizures if left untreated. Advising the client to take 2 acetaminophen tablets would be inappropriate and may lead to further complications if the client is not evaluated and treated. Although the application of cool compresses may ease the pain temporarily, this would delay treatment. Aspirin with codeine may temporarily relieve the client's headache. However, this delays immediate treatment, which is crucial. Additionally, pregnant women are advised not to take aspirin at this time because it may cause clotting problems in the neonate. Codeine generally is not prescribed. The nurse's assignment consists of 4 clients. Prioritize in order from highest to lowest priority in what order the nurse would assess these clients after receiving report. 1. An 85-year-old client with bacterial pneumonia, temperature of 102.2 degrees Fahrenheit, and shortness of breath. 2. A 60-year-old client with chest tubes who is postoperative for 2 days following a thoracotomy for lung cancer and is requesting something for pain. 3. A 35-year-old client with suspected tuberculosis who has a cough. 4. A 56-year-old client with emphysema who has a scheduled dose of a bronchodilator due to be administered with no report of acute respiratory distress. The correct order is 1, 2, 4, and 3. The elderly client with pneumonia, an elevated temperature, and shortness of breath is the most acutely ill client described and should be the client with the highest priority. The elevated temperature and the shortness of breath can lead to a decrease in the client's oxygen levels and can predispose the client to dehydration and confusion. Then the nurse should assess the client with a thoracotomy who is requesting pain medication and administer any needed medication. The client with emphysema should be the next priority so that the bronchodilator can be administered on schedule as close as possible. The nurse would then assess the client with suspected tuberculosis and a cough. When developing a plan of care for a newly admitted 2-year-old child with a diagnosis of Kawasaki disease, which of the following should be the priority? 1. Taking vital signs every 6 hours. 2. Monitoring intake and output every hour. 3. Minimizing skin discomfort. 4. Providing passive range of motion exercises. The correct answer is 2. Cardiac status must be monitored carefully in the initial phase of KD because the child is at high risk for congestive heart failure. Therefore, the nurse needs to assess the child frequently for signs of CHF, which would include respiratory distress, and decreased urine output. Vital signs will be obtained more often than every 6 hours because of the risk of CHF, although minimizing skin discomfort would be important. It does not take priority over monitoring the child's hourly intake and output. Passive range of motion exercises will be done if the child develops arthritis. The primary healthcare provider prescribes intravenous magnesium sulfate for a preemie gravida client at 38 weeks gestation diagnosed with severe preeclampsia. Which of the following medications should the nurse have readily available at the client's bedside? 1. Diazepam. 2. Hydralazine. 3. Calcium gluconate. 4. Phenytoin. The correct answer is 3. The client receiving magnesium sulfate intravenously is at risk for possible toxicity. The antidote for magnesium sulfate toxicity is calcium gluconate, which should be readily available at the client's bedside. Diazepam, used to treat anxiety, usually is not given to pregnant women. Hydralazine would be used to treat hypertension, and phenytoin would be used to treat seizures. A 79-year-old client is admitted to the hospital with a diagnosis of bacterial pneumonia. While obtaining the client's health history, the nurse learns that the client has osteoarthritis, follows a vegetarian diet, and is very concerned with cleanliness. Which of the following would most likely be a predisposing factor for the diagnosis of pneumonia? 1. Age. 2. Osteoarthritis. 3. Vegetarian diet. 4. Daily bathing. The correct answer is 1. The client's age is a predisposing factor for pneumonia. Pneumonia is more common in elderly or debilitated clients. Other predisposing factors include smoking, upper respiratory tract infections, malnutrition, immunosuppression, and the presence of a chronic illness. Osteoarthritis, a nutritionally sound vegetarian diet, and frequent bathing are not predisposing factors for pneumonia. A 16-month-old child diagnosed with Kawasaki disease is very irritable, refuses to eat, and exhibits peeling skin on the hands and feet. The nurse should do which of the following first? 1. Apply lotion to the hands and feet. 2. Offer food the toddler likes. 3. Place the toddler in a quiet environment. 4. Encourage the parents to get some rest. The correct answer is 3. One of the characteristics of children with KD is irritability. They are often inconsolable. Placing the child in a quiet environment may help quiet the child and reduce the workload of the heart. Although peeling of the skin occurs with KD, the child's irritability takes priority over applying lotion to the hands and feet. Children with KD usually are not hungry and do not eat well regardless of what is served. There is no indication that the parents need rest. Additionally, in this situation, the child takes priority over the parents. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client at 28 weeks gestation presents to the emergency department with a splitting headache. What actions are indicated by the nurse at this time? Select all that apply. 1. Reassure the client that headaches are a normal part of pregnancy. 2. Assess the client for vision changes or epigastric pain. 3. Obtain a non-stress test. 4. Assess the client's reflexes and presence of clonus. 5. Determine if the client has a documented ultrasound for this pregnancy. The correct answers are 2, 3, and 4. Headaches could be a sign of preeclampsia/eclampsia in pregnancy. The client should be assessed for headache, vision changes, epigastric pain, hyperreflexes, and the presence of clonus. Her fetus should be assessed using a non-stress test. An ultrasound done in this pregnancy does not give information to assess the presence of preeclampsia/eclampsia. Which of the following would the nurse identify as the priority to achieve when developing the plan of care for a prima gravida client at 38 weeks gestation who is hospitalized with severe preeclampsia and receiving intravenous magnesium sulfate? 1. Decrease generalized edema within 8 hours. 2. Decrease urinary output during the first 24 hours. 3. Sedation and decreased reflex excitability within 48 hours. 4. Absence of any seizure activity during the first 48 hours. The correct answer is 4. The highest priority for a client with severe preeclampsia is to prevent seizures, thereby minimizing the possibility of adverse effects on the mother and fetus, and then to facilitate safe childbirth. Efforts to decrease edema, reduce blood pressure, increase urine output, limit kidney damage, and maintain sedation are desirable but are not as important as preventing seizures. It would take several days or weeks for the edema to be decreased. Sedation and decreased reflex excitability can occur with the administration of intravenous magnesium sulfate, which peaks in 30 minutes, much sooner than 48 hours. The nurse is administering intravenous magnesium sulfate as prescribed for a client at 34 weeks gestation with severe preeclampsia. Which of the following are desired outcomes of this therapy? Select all that apply. 1. Temperature, 98 degrees Fahrenheit. Pulse, 72. Respiration, 14. 2. Urinary output less than 30 milliliters per hour. 3. Fetal heart rate with late decelerations. 4. BP of less than 140/90. 5. Deep tendon reflexes 2+. 6. Magnesium level equals 5.6 milligrams per deciliter. The correct answers are 1, 5, and 6. The use of magnesium sulfate as an anticonvulsant acts to depress the central nervous system by blocking peripheral neuromuscular transmissions and decreasing the amount of acetylcholine liberated. While being used, the temperature and pulse of clients should remain within normal limits. The respiratory rate needs to be greater than 12 respirations per minute. Rates at 12 respirations per minute or lower are associated with respiratory depression and are seen with magnesium toxicity. Renal compromise is identified with urinary output of less than 30 milliliters per hour. A fetal heart rate that is maintained within the 112 to 160 range is desired without later or variable decelerations. Deep tendon reflexes should not be diminished or exaggerated. The therapeutic magnesium sulfate level 5 to 8 milligrams per deciliter is to be maintained. Soon after admission of a prima gravida client at 38 weeks gestation with severe preeclampsia, the primary healthcare provider prescribes a continuous intravenous infusion of 5% dextrose in Ringer solution and 4 grams of magnesium sulfate. While the medication is being administered, which of the following assessment findings should the nurse report immediately? 1. Respiratory rate of 11 breaths per minute. 2. Patellar reflex of +2. 3. Blood pressure of 160/88. 4. Urinary output exceeding intake. The correct answer is 1. A respiratory rate of 11 breaths per minute suggests potential respiratory depression, an adverse effect of magnesium sulfate therapy. The medication must be stopped, and the primary healthcare provider should be notified immediately. A patellar reflex of +2 is normal. Absence of patellar reflex suggests magnesium toxicity. A blood pressure reading of 160/88 would be a common finding in a client with severe preeclampsia. Urinary output exceeding intake is not likely in a client receiving intravenous magnesium sulfate. Oliguria is more common. As the nurse enters the room of a newly admitted prima gravida client diagnosed with severe preeclampsia, the client begins to experience a seizure. Which of the following should the nurse do first? 1. Insert an airway to improve oxygenation. 2. Note the time when the seizure begins and ends. 3. Call for immediate assistance. 4. Turn the client to her left side. The correct answer is 3. If a client begins to have a seizure, the first action by the nurse is to remain with the client and call for immediate assistance. The nurse needs to have some assistance in managing this client. After the seizure, the client needs intensive monitoring. An airway can be inserted, if appropriate, after the seizure ends. Noting the time the seizure begins and ends and turning the client to her left side should be done after assistance is obtained. After administering hydralazine 5 milligrams intravenously as prescribed for a premigravida client with severe preeclampsia at 39 weeks gestation, the nurse should assess the client for 1. Tachycardia, 2. Bradypnea, 3. Polyuria, 4. Dysphagia. The correct answer is 1. One of the most common adverse effects of the drug hydralazine is tachycardia. Therefore, the nurse should assess the client's heart rate and pulse. Hydralazine acts to lower blood pressure by peripheral dilation without interfering with placental circulation. Bradypnea and polyuria are usually not associated with hydralazine use. Dysphagia is not a typical adverse effect of hydralazine. A premigravida client with severe preeclampsia exhibits hyperactive, very brisk patellar reflexes with 2 beats of ankle clonus present. The nurse documents the patellar reflexes as which of the following? 1, 1 plus, 2, 2 plus, 3, 3 plus, 4, 4 plus. The correct answer is 4. These findings will be documented as 4 plus. 1 plus indicates a diminished response. 2 plus indicates a normal response. 3 plus indicates a response that is brisker than average but not abnormal. Mild clonus is said to be present when there are 2 movements. A 16-year-old unmarried premigravida client at 37 weeks gestation with severe preeclampsia is in early active labor. The client's blood pressure is 164/110, which of the following will alert the nurse that the client may be about to experience a seizure? 1. Decreased contraction intensity. 2. Decreased temperature. 3. Epigastric pain. 4. Hyperreflexia. The correct answer is 3. Epigastric pain or acute right upper quadrant pain is associated with the development of eclampsia and an impending seizure. This is thought to be related to liver ischemia. Decreased contraction intensity is unrelated to the severity of the preeclampsia. Typically, the client's temperature increases because of increased cerebral pressure. A decrease in temperature is unrelated to an impending seizure. Hyperreflexia is not associated with an impending seizure. Typically, the client would exhibit hyperreflexia. Following an eclamptic seizure, the nurse should assess the client for which of the following? 1. Polyuria. 2. Facial flushing. 3. Hypotension. 4. Uterine contractions. The correct answer is 4. After an eclamptic seizure, the client commonly falls into a deep sleep or coma. The nurse must continually monitor the client for signs of impending labor. Because the client will not be able to verbalize that contractions are occurring, oliguria is more common than polyuria after an eclamptic seizure. Facial flushing is not common unless it is caused by a reaction to a medication. Typically, the client remains hypertensive unless medications, such as magnesium sulfate, are administered. A client at 36 weeks gestation begins to exhibit signs of labor after an eclamptic seizure. The nurse should assess the client for 1. Abruptio placentae. 2. Transverse lie. 3. Placenta accreta. 4. Uterine adeny. The correct answer is 1. After an eclamptic seizure, the client is at risk for abruptio placentae due to severe vasoconstriction resulting in hemorrhage into the decidua basalis. Abruptio placentae is manifested by a board-like abdomen and an abnormal fetal heart rate tracing. Transverse lie or shoulder presentation, placenta accreta, and uterine adeny are not related to eclampsia. Causes of a transverse lie may include relaxation of the abdominal wall secondary to grand multiparity, preterm fetus, placenta previa, abnormal uterus, contracted pelvis and excessive amniotic fluid. Placenta accreta, a rare phenomenon, refers to a condition in which the placenta abnormally adheres to the uterine lining. Uterine atony, or relaxed uterus, may occur after childbirth, leading to postpartum hemorrhage. The nurse is reviewing the chart of a multigravida client at 39 weeks gestation with suspected HELP syndrome. The nurse should notify the healthcare provider about which of the following test results. 1. Platelets 200,000. 2. Lactate dehydrogenase greater than 200 units per liter. 3. Uric acid 3 milligrams per deciliter. 4. Aspartate aminotransferase 15 units per liter. The correct answer is 2. The normal value of LDH in a non-pregnant person is 45 to 90 units per liter. LDH elevations indicate tissue destruction that can occur with HELP syndrome. This platelet range is in the normal range and remains unchanged during pregnancy. Uric acid in a non-pregnant woman is 2 to 6.6 milligrams per deciliter. AST normal range is 4 to 20 units per liter. An obese 36-year-old multigravida client at 12 weeks gestation has a history of chronic hypertension. She was treated with methyl-dopa before becoming pregnant. When counseling the client about diet during pregnancy, the nurse realizes that the client needs additional instruction when she states which of the following. 1. I need to reduce my caloric intake to 1,200 calories per day. 2. A regular diet is recommended during pregnancy. 3. I should eat more frequent meals if I get heartburn. 4. I need to consume more fluids and fiber each day. The correct answer is 1. Pregnancy is not the time for clients to begin a diet. Clients with chronic hypertension need to consume adequate calories to support fetal growth and development. They also need an adequate protein intake. Meat and beans are good sources of protein. Most pregnant women report that eating more frequent, smaller meals decreases heartburn resulting from the reflux of acidic secretions into the lower esophagus. Pregnant women need adequate hydration and fiber to prevent constipation. After reinforcing the danger signs to report with a Gravida 2 client at 32 weeks gestation with an elevated blood pressure, which client statements would demonstrate her understanding of when to call the primary healthcare provider's office. Select all that apply. 1. If I get up in the morning and feel dizzy, even if the dizziness goes away. 2. If I see any bleeding, even if I have no pain. 3. If I have a pounding headache, that doesn't go away. 4. If I notice the veins in my legs getting bigger. 5. If the leg cramps at night are waking me up. 6. If the baby seems to be more active than usual. The correct answers are 2, 3, and 6. Vaginal bleeding with or without pain could signify placenta previa or abruptio placentae. Continuous or pounding headache could indicate an elevated blood pressure, and change in the strength or frequency of fetal movements could indicate that the fetus is in distress. Orthostatic hypotension can occur during pregnancy and can be alleviated by rising slowly. Leg veins may increase in size due to additional pressure from the increasing uterine size, while leg cramps may also occur and can commonly be decreased with calcium supplements. After instructing a multigravida client at 10 weeks gestation diagnosed with chronic hypertension about the need for frequent prenatal visits, the nurse determines that the instructions have been successful when the client states which of the following. 1. I may develop hyperthyroidism because of my high blood pressure. 2. I need close monitoring because I may have a small for gestational age infant. 3. It's possible that I will have excess amniotic fluid and may need a cesarean section. 4. I may develop placenta accreta, so I need to keep my clinic appointments. The correct answer is 2. Women with chronic hypertension during pregnancy are at risk for complications such as preeclampsia, about 25%, abruptio placentae, and intrauterine growth retardation, resulting in a small for gestational age infant. There is no association between chronic hypertension and hyperthyroidism. Pregnant women with chronic hypertension are not at an increased risk for hydramnios, an abnormally large amount of amniotic fluid. Clients with diabetes and multiple gestations are at risk for this condition. Placenta accreta, a rare placental abnormality, refers to a condition in which the placenta abnormally adheres to the uterine lining. It is not associated with chronic hypertension. A client presents to the OB triage unit with no prenatal care and painless bright red vaginal bleeding. Which interventions are most indicated? 1. Apply an external fetal monitor and complete physical assessment. 2. Apply an external fetal monitor and perform sterile vaginal exam. 3. Obtaining a fundal height physical assessment on the patient. 4. Obtaining fundal height and a sterile vaginal exam. The correct answer is 1. Bright red vaginal bleeding without contractions could indicate a placenta previa. A sterile vaginal exam should never be done on a woman with a known or suspected placenta previa. Applying the external fetal monitor will allow the nurse to assess fetal status. A complete physical assessment of the patient is indicated. A fundal height is used to monitor fetal growth during pregnancy, but does not provide information related to vaginal bleeding. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client presents to the OB triage unit with a report of bright red vaginal bleeding that has saturated a peripad over the last hour. The nurse observed the fetal heart rate with a baseline of 130 decreasing to 100 for 60 seconds and then returning to 130. There are no contractions present. Which of the priority nursing interventions? 1. Ask client time of last oral intake and prepare to start an IV. 2. Continue to observe, monitor, and perform Leopold's maneuver. 3. Apply oxygen by face mask and perform sterile vaginal exam. 4. Place client in hands and knees position and call primary healthcare provider. The correct answer is 1. Because the woman is currently bleeding and the fetal heart rate is showing decelerations, the woman would need fluid replacement and a possible emergent cesarean birth. The woman may also need fluid volume replacement. The nurse can prepare for this by asking last oral intake, obtaining IV access. The client should be placed in a lateral position to enhance uteroplacental blood flow and given oxygen. The nurse should notify the primary healthcare provider as soon as possible, but the hands and knees position is indicated only if the client is experiencing back labor or umbilical cord prolapse. Leopold maneuver is done to determine fetal position in utero and would have already been done prior to placing the fetal heart rate monitor. The nurse is caring for a 22-year-old G2, P2 client who has disseminated intravascular coagulation after delivering a dead fetus. Which finding is the highest priority to report to the healthcare provider? 1. Activated partial thromboplastin time of 30 seconds. 2. Hemoglobin of 11.5 grams per deciliter. 3. Urinary output of 25 milliliters in the past hour. 4. Platelets at 149,000. The correct answer is 3. Urinary output of less than 30 milliliters per hour indicates renal compromise and would be the most important assessment finding to report to the healthcare provider. The APTT is within normal limits, and the hemoglobin is lower than value for an adult female, but within normal limits for a pregnant female. Although the platelet level is slightly low and may impact blood clotting when compared to renal failure, it is less important. A 24-year-old client, G3, P1, at 32 weeks gestation, is admitted to the hospital because of vaginal bleeding. After reviewing the client's history, which of the following factors might lead the nurse to suspect abruptio placentae? 1. Several hypotensive episodes. 2. Previous low transverse cesarean birth. 3. One induced abortion. 4. History of cigarette smoking. The correct answer is 4. Although the exact cause of abruptio placentae is unknown, possible contributing factors include excessive intrauterine pressure caused by hydramnios or multiple pregnancy, cigarette smoking, alcohol ingestion, trauma, increased maternal age and parity, and amniotomy. A history of hypertension is associated with an increased risk of abruptio placentae. A previous low transverse cesarean section and a history of one-induced abortion are associated with increased risk of placenta previa, not abruptio placentae. When caring for a multigravida client admitted to the hospital with vaginal bleeding at 38 weeks gestation, which of the following would the nurse anticipate administering intravenously if the client develops disseminated intravascular coagulation? 1. Ringer's lactate solution. 2. Fresh frozen platelets. 3. 5% dextrose solution. 4. Warfarin sodium. The correct answer is 2. Treatment of DIC includes treating the causative factor, replacing maternal coagulation factors, and supporting physiologic functions. Intravenous infusions of whole blood, fresh frozen plasma, or platelets are used to replace depleted maternal coagulation factors. Although Ringer's lactate solution and 5% dextrose solution may be used as intravenous fluid replacement, the client needs blood component therapy. Therefore, normal saline must be used. Intravenous heparin, not warfarin sodium, may be administered to halt the clotting cascade. When assessing a 34-year-old multigravida client at 34 weeks gestation experiencing moderate vaginal bleeding, which the following would most likely alert the nurse that placenta previa is present? 1. Painless vaginal bleeding. 2. Uterine tetany. 3. Intermittent pain with spotting. 4. Dull lower back pain. The correct answer is 1. The most common assessment finding associated with placenta previa is painless vaginal bleeding. With placenta previa, the placenta is abnormally implanted, covering a portion or all of the cervical OS. Uterine tetany, intermittent pain with spotting, and dull lower back pain are not associated with placenta previa. Uterine tetany is associated with oxytocin administration. Intermittent pain with spotting commonly is associated with spontaneous abortion. Dull lower back pain is commonly associated with poor maternal posture or urinary tract infection with renal involvement. The primary health care provider prescribes whole blood replacement for a multigravida client with abruptio placentae. Before administering the intravenous blood product, the nurse should first 1. Validate client information and the blood product with another nurse. 2. Check the vital signs before transfusing over 5 to 6 hours. 3. Ask the client if she has ever had any allergies. 4. Administer 100 milliliters of 5% dextrose solution intravenously. The correct answer is 1. When administering blood replacement therapy, extreme caution is needed before administering any blood product. The nurse should validate the client information and the blood product with another nurse to prevent administration of the wrong blood transfusion. Although baseline vital signs are necessary, she should initiate the infusion of blood slowly for the first 10 to 15 minutes. Then, if there is no evidence of a reaction, she should adjust the rate of infusion to ensure that the blood product is infused over 2 to 4 hours. The nurse can ask the client if she has ever had a reaction to a blood product, but a general question about allergies may not elicit the most complete response about any reactions to blood product administration. Blood transfusions are typically given with intravenous normal saline solution, not dextrose solutions. Following a cesarean birth for abruptio placentae, a multigravida client tells a nurse, "I feel like such a failure. None of my other childbirths were like this." The nurse's response to the client is based on the understanding of which of the following? 1. The client will most likely have postpartum blues. 2. Maternal-infant bonding is likely to be difficult. 3. The client's feeling of grief is a normal reaction. 4. This type of birth was necessary to save the client's life. The correct answer is 3. Feelings of loss, grief, and guilt are normal after cesarean birth, particularly if it was not planned. The nurse should support the client, listen with empathy, and allow the client time to grieve. The likelihood of the client experiencing postpartum blues is not known, and no evidence is presented. Although maternal-infant bonding may be delayed owing to neonatal complications or maternal pain and subsequent medications, it should not be difficult. Although the nurse is aware that this type of birth was necessary to save the client's life, Using this as the basis for the response does not acknowledge the mother's feelings. The nurse should do which of the following actions first when admitting a multigravida client at 36 weeks gestation with a probable diagnosis of abruptio placentae? 1. Prepare the client for a vaginal examination. 2. Obtain a brief history from the client. 3. Insert a large gauge intravenous catheter. 4. Prepare the client for an ultrasound scan. The correct answer is 3. Abruptio placentae is a medical emergency because the degree of hypovolemic shock may be out of proportion to visible blood loss. On admission, the nurse should plan to first insert a large gauge intravenous catheter for fluid replacement and oxygen by mask to decrease fetal anoxia. Vaginal examination usually is not performed on pregnant clients who are experiencing third trimester bleeding due to abruptio placentae because it can result in damage to placenta and further fetal anoxia. The client's history can be obtained once the client has been admitted and the intravenous line has been started. The goal is birth of the fetus, usually by emergency cesarean section. The nurse should also plan to monitor the client's vital signs and the fetal heart rate. Ultrasound is of limited use in the diagnosis of abruptio placentae. The nurse who is caring for a client with kidney failure notes that the client is dyspneic and crackles are heard on auscultation of the lungs. Which additional signs/symptoms should the nurse expect to note in this client? 1. Rapid weight loss. 2. Flat hand and neck veins. 3. A weak and thready pulse. 4. An increase in blood pressure. The correct answer is 4. Impaired cardiac or kidney function can result in fluid volume excess. Findings associated with fluid volume excess include cough, dyspnea, crackles, tachypnea, tachycardia, an elevated blood pressure, a bounding pulse, an elevated central venous pressure, weight gain, edema, neck and hand vein distension, an altered level of consciousness, and a decreased hematocrit level. A young client diagnosed with paranoid schizophrenia is talking with a nurse. You know, when I thought everyone was out to get me, I was staying in my apartment all the time. Now, I'd like to get out and do things again. What is the best initial response by the nurse? 1. With whom do you want to do things? 2. What activities did you enjoy in the past? 3. What kind of transportation do you use? 4. How much money can you spend? The correct answer is 2. Knowing the client's interests is the best place to begin to help the client re-socialize. Knowing with whom the client wishes to socialize, what transportation she has, or how much spending money she has may be relevant questions, but should be asked after the question concerning what activities the client enjoyed in the past. A client is becoming agitated during a discussion group. She states, "I know that all of you hate me." She leaves the group and goes to her room. Which action by the nurse is most therapeutic for the client? 1. After group, ask the client to talk to the nurse about her concerns. 2. Ask the client to return to group and share feelings. 3. Explain to group members about the client's problems. 4. Ask the group members to apologize to the client individually. The correct answer is 1. It is appropriate to talk alone with this client about her feelings. A suspicious client is unlikely to agree to talk about feelings in a group. It is a violation of the client's privacy to reveal a client's problems to group members. The other clients in the group have no reason to apologize, and the nurse should not ask them to do so. A client who is neatly dressed and clutching a leather briefcase tightly in his arms scans the adult inpatient unit on his arrival at the hospital and backs away from the window. The client requests that the nurse move away from the window. The nurse recognizes that doing as the client requested is contraindicated for which of the following reasons? 1. The action will make the client feel that the nurse is humoring him. 2. The action indicates nonverbal agreement with the client's false ideas. 3. The client will then think that he will have his way when he wishes. 4. The nurse will be demonstrating a lack of composure over the situation. The correct answer is 2. The nurse's nonverbal behavior, moving away from the window as the client requests, indicates agreement with the client's false ideas. The client's behavior is likely to be reinforced if the nurse takes steps to agree with the false ideas the client holds. A client reports having thoughts of being followed by foreign agents who are after his secret papers. Which response by the nurse is most appropriate when responding to the client's disturbed thought process? 1. I don't see any foreign agents. 2. I think these thoughts are frightening to you. 3. I don't know what you mean. 4. I'd like you to come to group with me right now. The correct answer is 2. The client's disturbed thought process likely reflects this client's paranoid delusions. The nurse should acknowledge that the thoughts are frightening the client. Telling the client the nurse does not see any foreign agents is an appropriate nursing response if the client is having disturbed visual sensory perception and is having visual hallucinations. Telling the client the nurse does not understand what the client means is an appropriate response if the client has impaired verbal communication. Suggesting that a client participate in group activities would be appropriate if the client had a nursing diagnosis of social isolation and was staying in his room. Police bring a client to the emergency department after she threatens to delete her ex-husband. She states emphatically, "The police should bring him in, not me. He's paranoid about my dating and has been stalking me for weeks. He's probably off his medicines. His case manager and the police won't do anything." In which order should the following nursing actions be done from first to last? 1. Ask about the marital problems leading to the divorce. 2. Assess the client's risk for harm to self and others. 3. Obtain the name of her ex-husband's case manager. 4. Interview the client about her current needs and situation. The correct order is 2, 4, 3, 1. The nurse should first assess the client's risk for harm, especially because the client could direct her anger toward her ex-husband or the nurse. Then it is important to know more about her current situation and her immediate needs. Obtaining information from the ex-husband's case manager might help clarify the risk of harm to the client. Problems leading to the divorce are less important than the situation following the divorce. A client who has been stabilized on medications for several months is at the clinic for a medication check. During conversation with a nurse, the client suddenly jumps up, begins pacing, and wrings her hands. In what order should the nurse do the following interventions from first to last? 1. Walk with the client to help decrease her anxiety. 2. Discuss productive ways to solve her problems causing anxiety. 3. Share observations about her anxiety-related behaviors. 4. Ask the client about the sources of her anxiety. The correct order is 1, 3, 4, 2. The nurse should first walk with the client to reduce her anxiety because the client must be at a mild level of anxiety before learning can occur. Sharing observations with the client conveys a sense of caring. Later, the nurse can help the client connect the anxiety-related behaviors to her feelings of anxiety. Once the client can identify the source of her anxiety, she can talk about solutions. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client is receiving haloperidol decanoate. He has stiff muscles, restlessness, and internal jumpiness. The client has all of the following medications prescribed as needed. Which one would be most appropriate for the nurse to administer to decrease the client's symptoms? 1. Lorazepam. 2. Benztropine mesylate. 3. Trazodone. 4. Olanzapine. The correct answer is 2. The reported symptoms are signs of extrapyramidal side effects. The medication of choice is benztropine, an anti-Parkinson medicine. Lorazepam is an anti-anxiety agent. Trazodone is an antidepressant used to enhance sleep. Olanzapine is an antipsychotic medication that could aggravate the extrapyramidal side effects. The parents of a 20-year-old female client diagnosed with paranoid schizophrenia admitted 4 days ago are attending a family psychoeducation group in a hospital. Which of the following statements by the mother indicates that she understands her daughter's illness and management? 1. I know that I'll have to do everything for my daughter when she comes home. 2. Tasks as simple as getting out of bed and showering in the morning may be difficult for her. 3. I know that visits from her friends at home should be discouraged for a while. 4. She won't experience a relapse as long as she takes her prescribed medication. The correct answer is 2. Clients with paranoid schizophrenia experience alterations in thought resulting in introspection, confusion, and distraction from external reality. Simple tasks that require concentration and effort, including activities involving self-care, may be difficult for the client, especially during the acute phase of the illness. However, the mother should not need to do everything for her daughter. Rather, the mother should encourage the daughter to do things for herself with guidance. Visits from friends should be discussed with the client, and the client should be encouraged to visit with friends to minimize the risk of social isolation. Although relapse typically occurs with medication noncompliance, vulnerability to stress, a low threshold for stress, the number of stresses, and a client's lack of adaptive coping behaviors contribute to relapse. While conducting a home visit for a client diagnosed with paranoid schizophrenia discharged 1 week ago, the client's mother tearfully states, "I can hardly sleep because I'm so worried about my daughter. I'm afraid to leave her alone in the house. What if something should happen while I'm gone?" Which of the following problems related to the caregiver will be the most inclusive one for the nurse to incorporate into the client's plan of care? 1. Caregiver role strain. 2. Anxiety. 3. Fear. 4. Disturbed sleep pattern. The correct answer is 1. The nurse recognizes the mother's feelings of being overwhelmed with the issues concerning the management of her daughter at home as caregiver role strain. Anxiety, fear, and sleep disturbances all contribute to caregiver role strain. The nurse should help the mother elicit the support of other family members or friends, continue with psychoeducation, and help the family connect with the Alliance for the Mentally Ill for support, reassurance, and education. When conducting a mental status examination with a newly admitted client who has an axis-I diagnosis of paranoid schizophrenia, the client states, "I'm being followed. It's not safe. They're monitoring my every move." In which of the following areas of the mental status examination should the nurse document this information? 1. Thought content. 2. Quality of speech. 3. Insight. 4. Judgment. The correct answer is 1. The client is voicing paranoid delusions of being followed and monitored. Presence of delusions is described in the area of thought content in the mental status examination. The speech section would typically include documentation of disturbances in speech or pressured speech. In the insight section, the nurse would document information reflecting a lack of insight. For example, statements such as, "I don't have a problem." In the judgment section, the nurse would document information reflecting a lack of judgment. For example, poor choices such as buying a gun for self-protection. The wife of a client diagnosed with paranoid schizophrenia visits 2 days after her husband's admission and states to the nurse, "Why isn't he eating? He's still talking about his food being poisoned." Which of the following appraisals by the nurse is most accurate? 1. The wife's inquiry is reasonable. 2. Education about her husband's medications is needed. 3. Her expectations of her husband are realistic. 4. An increase in the client's medication is indicated. The correct answer is 2. For the client with paranoid schizophrenia, 2 days on medication is too short a time for improvement to be seen. Therefore, the nurse evaluates the client's wife as needing education or knowledge about paranoid schizophrenia, the course of the illness, and medications. Expecting an absence of delusions by the end of the client's second day of hospitalization is unrealistic. Rather, the nurse would reasonably expect delusions to decrease, disappearing by 5 to 9 days of hospitalization. The wife's inquiry is not reasonable because not enough time has elapsed to evaluate the effectiveness of treatment. An increase in the client's medication would be unreasonable because not enough time has elapsed to evaluate the effectiveness of the medication. Generally, a time frame of 5 to 7 days is needed before the effectiveness of medications can be determined. A client states that she hears God's voice telling her that she has sinned and needs to punish herself. Which response by the nurse is most important? 1. How do you think you will be punished? 2. Please tell staff when you think you need to punish yourself. 3. What exactly do you think you have done to be punished? 4. Let's talk about your strengths. The correct answer is 2. The client is at risk for harming herself because of the command auditory hallucinations. It is most important for the staff to know if she currently thinks she needs to punish herself. Then it is important to know how she thinks she might punish herself. Knowing what she thinks she has done is relevant for changing her negative thinking. Focusing on her strengths will help improve her self-esteem. When developing the plan of care for a client who is staying in his room because he perceives that staff want to harm him, which of the following outcomes of care planning is most realistic? 1. Within 2 days, the client will complete activities of daily living. 2. Within 3 days, the client will participate in recreation with other clients. 3. Within 4 days, the client will demonstrate an absence of verbal aggression. 4. Within 5 days, the client will seek out staff to talk about feelings. The correct answer is 4. The client is exhibiting suspiciousness of and a lack of trust in the staff, not aggression. Seeking out staff indicates the development of trust and decreased suspiciousness. Although completing activities of daily living and participating in recreation with other clients are important, the major problem presented is related to the client's isolation and perception of being harmed, not, for example, showering, hygiene, or other clients. A client diagnosed with paranoid schizophrenia is still withdrawn, unkempt, and unmotivated to get out of bed. A mental health aide asks the nurse why the client is this way after being on fluphenazine 10 milligrams for 7 days. The nurse should tell the health aide, 1. Fluphenazine is most effective with the positive symptoms of schizophrenia. 2. The client will be less withdrawn and unmotivated when the fluphenazine takes effect. 3. The client's fluphenazine dose probably needs to be increased again. 4. Lack of motivation is a common side effect of fluphenazine. The correct answer is 1. Fluphenazine is most effective with the positive symptoms of schizophrenia. Positive symptoms are those that are added to a person's experience, such as hallucinations, delusions, and disorganized thinking. The client's symptoms reflect the negative symptoms. Negative symptoms are things taken away from the person's experience, such as lack of emotional expression, lack of motivation or drive, and social withdrawal. Fluphenazine generally is effective in 3 to 7 days for the positive symptoms. An increased dose or longer time on fluphenazine will not help the negative symptoms of being withdrawn and unmotivated. A pregnant client in her 3rd trimester is started on chlorpromazine 25 milligrams 4 times daily. Which of the following instructions is most important for the nurse to include in the client's teaching plan? 1. Don't drive because there's a possibility of seizures occurring. 2. Avoid going out in the sun without a sunscreen with sun protection factor at 25. 3. Stop the medication immediately if constipation occurs. 4. Tell your doctor if you experience an increase in blood pressure. The correct answer is 2. Chlorpromazine is a low-potency antipsychotic that is likely to cause sun-sensitive skin. Therefore, the client needs instructions about using sunscreen with sun protection factor 25 or higher. Typically, chlorpromazine is not associated with an increased risk of seizures. Although constipation is a common adverse effect of this drug, it can be managed with diet, fluids, and exercise. The drug does not need to be discontinued. Chlorpromazine is associated with postural hypotension, not hypertension. Additionally, if postural hypotension occurs, safety measures, such as changing position slowly and dangling the feet before rising, not stopping the drug, are instituted. A client reports that men in blue clothes keep looking in her window and talking about her. Which of the following responses by the nurse is most appropriate? 1. Those men are groundskeepers. They're talking about their work, not you. 2. Don't take things so personally. Not everyone who is talking about you. 3. Let's not pay attention to men. Let's play cards instead. 4. I'll close the drapes so you can't see the men. The correct answer is 1. The nurse needs to present the reality of the situation. By explaining that the men are groundskeepers and probably talking about work, the nurse is reinforcing reality to counter the client's illusion. Additionally, this response voices doubt in the client's paranoid interpretation. Telling the client not to take things personally is flippant and judgmental. Telling the client to not pay attention to the men fails to address the client's misinterpretations and misperceptions. Closing the drapes so that the client doesn't see the men ignores the client's misperceptions and misinterpretation. When preparing the teaching plan for a client who is to start clozapine, which of the following is crucial to include? 1. Description of akathisia and drug-induced Parkinsonism. 2. Measures to relieve episodes of diarrhea. 3. The importance of reporting insomnia. 4. An emphasis on the need for weekly blood tests. The correct answer is 4. Clozapine is associated with agranulocytosis. Therefore, the nurse must instruct the client about the need for weekly blood tests to monitor for this adverse effect. Akathisia and drug-induced Parkinsonism are associated with high-potency antipsychotics. These effects are not common with this atypical antipsychotic agent. Constipation and sedation may occur with this drug. A client is sitting in the corner of the day room cocking his head to one side as if he hears something, but no one is nearby. The nurse suspects he is having auditory hallucinations. Which of the following questions should the nurse ask first? 1. Are you seeing someone other than me? 2. What are you hearing right now? 3. What is going on with you right now? 4. Do you want to go to the recreation room? The correct answer is 2. Before intervening with the client experiencing hallucinations, the nurse must validate what the client is experiencing. Asking the client what he hears right now accomplishes this. Asking about seeing someone near the client would be appropriate to validate visual hallucinations. Asking the client about what is going on may be helpful. However, the question is too general to validate that the client is experiencing auditory hallucinations. Asking the client if he wants to go to the recreation room might be appropriate after the nurse has validated what the client is experiencing. A client who is newly diagnosed with paranoid schizophrenia tells a nurse, "The aliens are telling me that I'm defective and need to be eliminated." Which of the following responses by the nurse is most appropriate initially? 1. I know those voices are real to you, but I don't hear them. 2. You are having hallucinations as a result of your illness. 3. I want you to agree to tell staff when you hear these voices. 4. Your medications will help control these voices you are hearing. The correct answer is 3. The client may act on command hallucinations and harm himself or others. Therefore, the staff need to know when the client is hearing such commands to ensure safety first. Telling the client that the voices are real, but that the nurse doesn't hear them would be an appropriate response later in the client's hospitalization, when the client's safety is no longer an issue because antipsychotics are beginning to take effect. Telling the client that the hallucinations are part of the illness or that medications will help control the voices would be appropriate once the client has developed some insight into the symptoms of the illness. An outpatient client who has a history of paranoid schizophrenia and chronic alcohol dependency has been taking risperidone for several months. She reports that she stopped drinking 4 days ago. The client is very frightened by the tactile hallucinations of bugs crawling under her skin. Which of the following factors should the nurse incorporate into plan of care when explaining the tactile hallucinations? 1. Alcohol intoxication. 2. Ineffectiveness of risperidone. 3. Alcohol withdrawal. 4. Interaction of alcohol and risperidone. The correct answer is 3. Tactile hallucinations are more common in alcohol withdrawal than in schizophrenia. Therefore, the nurse should explain that these hallucinations are the result of withdrawal from alcohol. Because the client stopped drinking 4 days ago, the client is not intoxicated. Risperidone has little effect on symptoms of alcohol withdrawal. It is prescribed for symptoms of schizophrenia. Alcohol and risperidone have an additive effect, not one of causing hallucinations. A newly admitted client diagnosed with paranoid schizophrenia is pacing rapidly and wringing his hands. He states that another client is out to get him. Then he says, "Protect me, select me, reject me." The nurse should next 1. Administers oral PRN lorazepam and haloperidol. 2. Place the client in temporary seclusion before he has a chance to hurt others. 3. Call the primary healthcare provider for a prescription for restraints. 4. Ask the other clients to leave the immediate area. The correct answer is 1. The client anxiety, as reflected in rapid pacing and clang associations, is rising as a result of his paranoid delusions. Administering the lorazepam and haloperidol will help the anxiety and delusions. The client is not threatening others at this point, so seclusion, restraints, and asking clients to leave the area is not necessary. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. In a family education group for those who have relatives with paranoid schizophrenia, which of the following comments indicates the need for further teaching about symptom management? 1. When the clients get overwhelmed, it's best that they spend some time in their room. 2. The more we push the clients to spend time with friends, the more their voices decrease. 3. Until we get the clients up and going, they seem to have no motivation to do anything. 4. We still have to remind the clients that we don't hear the voices they do. The correct answer is 2. Pushing a suspicious client into social situations is likely to increase anxiety, which increases, not decreases, the hallucinations. The statement about spending some time alone if the client is overwhelmed indicates awareness and understanding of how to intervene when the client is exposed to stress. The statement about lack of motivation indicates awareness and understanding of avolition. The statement about reminding the client that the family doesn't hear the voices indicate awareness and understanding of the client's hallucinations. A client is being successfully treated with clozapine. Which of the following statements by the client reflects a need for further teaching about managing the drug's adverse effects? 1. If I eat too many fruits, I'll get constipated. 2. I need to take the medicine with food to avoid nausea. 3. I have to get up slowly so I don't get dizzy. 4. Sometimes I have to push myself because I'm sleepy. The correct answer is 1. Clozapine is the one atypical antipsychotic associated with severe anticholinergic adverse effects, such as constipation. Consuming fruits would not be the cause of the client's constipation. The client should take clozapine with food to avoid nausea. Getting up slowly indicates that the client understands that postural hypotension may occur with clozapine. The statement about sleepiness indicates that the client understands that sedation may occur with this drug. Which of the following statements indicates increased insight by the client about her newly diagnosed paranoid schizophrenia being stabilized on medications? 1. Now that the voices are gone, I can decrease my medicines. 2. I would feel better if I knew that the food wasn't too dangerous to eat. 3. Since I feel better, I know I can restart school next week. 4. The voices go away when I tell them to, except if I'm really nervous. The correct answer is 4. The statement about the voices occurring if the client is nervous reflects awareness that stress and anxiety can increase the positive symptoms of schizophrenia. Decreasing the medications because the voices are gone reveals a lack of awareness about the need for the medications to control the client's symptoms. Stating that the food is dangerous to eat demonstrates a lack of insight into the client's delusions. Restarting school in a week reflects an unrealistic expectation for a client who is newly diagnosed and being stabilized on medications. A client who is suspicious of others, including staff, is brought to the hospital wearing a wrinkled dress with stains on the front. Assessment also reveals a flat affect, confusion, and slow movements. Which goal should the nurse identify as the initial priority when planning this client's care? 1. Helping the client feel safe and accepted. 2. Introducing the client to other clients. 3. Giving the client information about the program. 4. Providing the client with clean, comfortable clothes. The correct answer is 1. The initial priority for this client is to help her overcome suspiciousness of others, including staff, and thereby feel safe and accepted. Introducing the client to others Giving the client information about the program and providing clean clothes are important, but these are of lower priority than helping the client feel safe and accepted. The parent of a young adult client diagnosed with paranoid schizophrenia is asking questions about his son's antipsychotic medication, ziprasidone. Which of the following statements by the father reflects a need for further teaching? 1. If he experiences restlessness or muscle stiffness, he should tell the doctor. 2. I should give him benztropine to help prevent constipation from the ziprasidone. 3. If he becomes dizzy, I'll make sure he doesn't drive. 4. The ziprasidone should help him be more motivated and less withdrawn. The correct answer is 2. Constipation caused by medication is best managed by diet, fluids, and exercise. Benztropine can increase constipation. However, it may be prescribed for restlessness and stiffness. Restlessness and stiffness should be reported to the primary health care provider. Drowsiness and dizziness are adverse effects of ziprasidone. Clients should not drive if they are experiencing dizziness. Ziprasidone does help improve the negative symptoms of schizophrenia, such as avolition. When teaching a client with heart failure about preventing complications and future hospitalizations, which problem stated by the client as reasons to call a physician would indicate to the nurse that the client has understood the teaching. Select all that apply. 1. Becoming increasingly short of breath at rest. 2. Weight gain of 2 pounds or more in one day. 3. High intake of sodium for breakfast. 4. Having to sleep sitting up in a reclining chair. 5. Weight loss of 2 pounds in one day. The correct answers are 1, 2, and 4. If the client will call the physician when there is increasing shortness of breath, weight gain over 2 pounds in one day, and need to sleep sitting up, this indicates an understanding of the teaching, because these signs and symptoms suggest worsening of the client's heart failure. Although the client will most likely be placed on a sodium-restricted diet, the client would not need to notify the physician if he or she had consumed a high-sodium breakfast. Instead, the client would need to be alert for possible signs and symptoms of worsening heart failure and work to reduce sodium intake for the rest of that day and in the future. The nurse is assessing a client who is taking an antipsychotic medication. Which of the following symptoms is uniquely indicative of neuroleptic malignant syndrome NMS and requires immediate attention? 1. Very high temperature. 2. Muscular rigidity. 3. Tremors. 4. Altered consciousness. The correct answer is 1. Muscular rigidity, tremors, and altered consciousness are symptoms of other movement disorders as well as NMS, such as extrapyramidal side effects. High temperature is unique to NMS, particularly when seen with the other 3 symptoms. NMS is potentially fatal and needs immediate attention. Which of the following symptoms is common in clients with active tuberculosis? 1. Weight loss. 2. Increased appetite. 3. Dyspnea on exertion. 4. Mental status changes. The correct answer is 1. Tuberculosis typically produces anorexia and weight loss. Other signs and symptoms may include fatigue, low-grade fever, and night sweats. Increased appetite is not a symptom of tuberculosis. Dyspnea on exertion and change in mental status are not common symptoms of tuberculosis. A client has a history of heart failure and has been taking furosemide Lasix, digoxin, lanoxin, and potassium chloride. The client has nausea, blurred vision, headache, and weakness. The nurse notes that the client is confused. The telemetry strip shows first-degree atrioventricular block. The nurse should assess the client for signs of which of the following? 1. Hyperkalemia. 2. Digoxin toxicity. 3. Fluid deficit. 4. Pulmonary edema. The correct answer is 2. Early symptoms of digoxin toxicity include anorexia, nausea, and vomiting. Visual disturbances can also occur, including double or blurred vision and visual halos. Hypokalemia is a common cause of digoxin toxicity associated with arrhythmias because low serum potassium can enhance ectopic pacemaker activity, although vomiting can lead to fluid deficit. Given the client's history, the vomiting is likely due to the adverse effects of digoxin toxicity. Pulmonary edema is manifested by dyspnea and coughing. As hospital-based care has become more oriented to crisis intervention, criteria for admission to the hospital have also changed. Which clients have priority for admission to an acute care facility? Select all that apply. 1. Clients who live alone. 2. Clients who are acutely psychotic. 3. Clients who are acutely depressed. 4. Clients who are dangerous to self or others. 5. Clients who are not sleeping and have a lack of appetite. 6. Clients who are not complying with medication regimens. The correct answers are 2 and 4. Safety issues, including protection of the client and others, are the priorities for admission. Acute psychosis commonly involves issues of safety. Living alone is not a sufficient reason to be admitted to a healthcare facility. Depression, insomnia, lack of appetite, and noncompliance are important issues, but not sufficient for admission unless combined with one of the other criteria. A client is receiving streptomycin in the treatment regimen of tuberculosis. The nurse should assess for 1. Decreased serum creatinine. 2. Difficulty swallowing. 3. Hearing loss. 4. IV infiltration. The correct answer is 3. Streptomycin can cause toxicity to the 8th cranial nerve, which is responsible for hearing, balance, and body position sense. Nephrotoxicity is a side effect that would be indicated with an increase in creatinine. Streptomycin is given via intramuscular injection. Which of the following sets of conditions is an indication that a client with a history of left side heart failure is developing pulmonary edema? Select all that apply. 1. Distended jugular veins. 2. Dependent edema. 3. Anorexia. 4. Coarse crackles. 5. Tachycardia. The correct answers are 4 and 5. Signs of pulmonary edema are identical to those of acute heart failure. Signs and symptoms are generally apparent in the respiratory system and include coarse crackles, severe dyspnea, and tachypnea. Severe tachycardia occurs due to sympathetic stimulation in the presence of hypoxemia. Blood pressure may be decreased or elevated, depending on the severity of the edema. Jugular vein distension, dependent edema, and anorexia are symptoms of right-sided heart failure. An outpatient visit 3 months after discharge from the hospital, a client says he has stopped his olanzapine even though it controls his symptoms of schizophrenia better than other medications. I have gained 20 pounds already. I can't stand anymore. Which response by the nurse is most appropriate? 1. I don't think you look fat. Why do you think so? 2. I can help you with a diet and exercise plan to keep your weight down. 3. You can be switched to another medicine. 4. Your weight gain will level off if you stay on the medication 3 more months. The correct answer is 2. Helping the client control his weight is the most appropriate approach. The nurse's contradiction of the client's statement is inappropriate. Most atypical antipsychotics cause weight gain and are not a solution to the weight gain. There is little evidence that weight gain from taking olanzapine decreases with time. The nurse is reconciling prescriptions for a client diagnosed recently with pulmonary tuberculosis who is being admitted to the hospital for a total hip replacement. The medication prescription sheet says isoniazid 300 mg PO daily, rifampin 600 mg PO daily, pyridoxine 10 mg PO daily, ethambutol 400 mg PO daily, and pyrazinamide 1.5 grams PO daily. The client asks if it is necessary to take all of these medications while in the hospital. The nurse should 1. Request that the healthcare provider review the prescriptions for a duplication between isoniazid and ethambutol. 2. Inform the client that all drugs will be discontinued until the client can eat solid foods. 3. Ask the pharmacist to check for drug interactions between the rifampin and isoniazid. 4. Tell the client that it is important to continue to take the medications because the combination of drugs prevents bacterial resistance. The correct answer is 4. The nurse should tell the client that it is necessary to take all of these medications because combination drug therapy prevents bacterial resistance. They will be administered throughout the hospitalization to maintain blood levels. The healthcare provider will review the prescriptions per hospital policy because the client is being admitted to hospital. There is no duplication between any of the drugs being prescribed for this client. It is not necessary to ask the pharmacist to check for drug interactions, as these drugs are commonly used together. The nurse is assessing a client with chronic heart failure who is demonstrating neurohormonal compensatory mechanisms. Which of the following are expected findings on assessment? Select all that apply. 1. Decreased cardiac output. 2. Increased heart rate. 3. Vasoconstriction in skin, GI tract, and kidneys. 4. Decreased pulmonary perfusion. 5. Fluid overload. The correct answers are 1, 2, 3, and 5. Heart failure can be a result of several cardiovascular conditions, which will affect the heart's ability to pump effectively. The body attempts to compensate through several neurohormonal mechanisms. Decreased cardiac output stimulates the aortic and carotid baroreceptors, which activates the sympathetic nervous system to release norepinephrine and epinephrine. This early response increases the heart rate and contractility. It also has some negative effects, including vasoconstriction of the skin, GI tract, and kidneys. Decreased renal perfusion due to low CO and vasoconstriction activates the renin-angiotensin-aldosterone process, resulting in the release of antidiuretic hormone. This causes fluid retention in an attempt to increase blood pressure, therefore cardiac output. In the damaged heart, this causes fluid overload. There is no parasympathetic response. Decreased pulmonary perfusion can be a result of fluid overload or concomitant pulmonary disease. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. One of the important aspects of the client's rights is the right to treatment in the least restrictive environment. The nurse observes this principle when making which decisions? Select all that apply. 1. Referring a client to a group home or supervised apartment living. 2. Releasing client information to a primary care physician or a relative. 3. Placing a client in seclusion or restraints. 4. Respecting the client's right to accept or refuse treatment. 5. Placing a committed client in a daily outpatient group or a weekly self-help group. The correct answers are 1, 3, and 5. Group homes, apartment programs, seclusion, restraints, day treatment programs, and self-help groups all involve degrees of restriction and supervision. Releasing information about the client is governed by legislation and rules of confidentiality. Accepting or refusing treatment is governed by laws related to informed consent. What is the rationale that supports multi-drug treatment for clients with tuberculosis? 1. Multiple drugs potentiate the drug's actions. 2. Multiple drugs reduce undesirable drug adverse effects. 3. Multiple drugs allow reduced drug dosages to be given. 4. Multiple drugs reduce development of resistant strains of the bacteria. The correct answer is 4. Use of a combination of anti-tuberculosis drugs slows the rate at which organisms develop drug resistance. Combination therapy also appears to be more effective than single drug therapy. Many drugs potentiate or inhibit the actions of other drugs. However, this is not the rationale for using multiple drugs to treat tuberculosis. Treatment with multiple drugs does not reduce adverse effects and may expose the client to more adverse effects. Combination therapy may allow some medications to be given in reduced dosages. However, reduced dosages are not prescribed for antibiotics and anti-tuberculosis drugs. In which of the following positions should the nurse place a client with heart failure who has orthopnea? 1. Semi-sitting low Fowler position with legs elevated on pillows. 2. Lying on the right side, Sims position with a pillow between the legs. 3. Sitting upright, high Fowler position with legs resting on the mattress. 4. Lying on the back with the head lowered, Trendelenburg position, and legs elevated. The correct answer is 3. Sitting almost upright in bed with the feet and legs resting on the mattress decreases venous return to the heart. thus reducing myocardial workload. Also, the sitting position allows maximum space for lung expansion. Low Fowler's position would be used if the client could not tolerate high Fowler's position for some reason. Lie on the right side would not be a good position for the client in heart failure. The client in heart failure would not tolerate Trendelenburg's position. When asked about her stresses before admission, an anxious client stares blankly at the nurse and mutters unintelligibly. Which of the following descriptions of the client's behaviors should the nurse document in the client's chart? 1. Client cannot answer any questions asked at this time. 2. Client is uncooperative during the admission procedure, refusing to answer any questions. 3. Client responded to questions with a blank look and incomprehensible mumble. 4. Client stared at the wall when asked questions and was disoriented and incoherent. The correct answer is 3. The nurse must be objective in documenting the client's behavior, recording exactly what the client did or did not say or do in a particular situation. Recording that the client could not answer any questions, was uncooperative and refused to answer questions, or was disoriented and incoherent is not described and is a subjective interpretation on the nurse's part. The nurse is reading the results of a tuberculin skin test. See the picture on the screen. The nurse should interpret the results as 1. Negative, 2. Needing to be repeated, 3. Positive, 4. False. The correct answer is 3. The tuberculin test is positive. The test should be interpreted 2 to 3 days after administering the purified protein derivative, PPD, by measuring the size of the firm raised area in duration. Positive responses indicate that the client may have been exposed to the tuberculosis bacteria. A negative response is indicated by the absence of a firm, raised area, or an area that is less than 5 millimeters in diameter. Since the test is positive, it is not necessary to redo the test. The test is positive, not false. A client with heart failure is receiving digoxin intravenously. The nurse should determine the effectiveness of the drug by assessing which of the following: 1. Dilated coronary arteries. 2. Increased myocardial contractility. 3. Decreased cardiac arrhythmias. 4. Decreased electrical conductivity in the heart. The correct answer is 2. Digoxin is a cardiac glycoside with positive inotropic activity. This inotropic activity causes increased strength of myocardial contractions and thereby increases output of blood from the left ventricle. Digoxin does not dilate coronary arteries. Although digoxin can be used to treat arrhythmias and does decrease the electrical conductivity of the myocardium, these are not primary reasons for its use in clients with heart failure and pulmonary edema. The nurse is instructing a client with chronic obstructive pulmonary disease how to do pursed-lip breathing. In which order should the nurse explain the steps to the client? 1. Breathe in normally through your nose for 2 counts. 2. Relax your neck and shoulder muscles. 3. Pucker your lips as if you're going to whistle. 4. Breathe out slowly through pursed lips for 4 counts. The correct order is 2, 1, 3, and 4. The nurse should first instruct the client to relax the neck and the shoulders and then take several normal breaths. After taking a breath in, the client should pucker the lips and finally breathe out through pursed lips. A client had a MAN-2 test result of an 8 millimeters in duration. The test is considered positive when the client: 1. Lives in a long-term care facility. 2. Has no known risk factors. 3. Is immunocompromised. 4. Works as a healthcare provider in a hospital. The correct answer is 3. An induration of more than 5 to 15 millimeters to 10 MAN-2 units is considered a positive result, indicating TB infection. An induration of greater than 5 millimeters is found in HIV-positive individuals, those with recent contacts with persons with TB, persons with nodular or fibrotic changes on chest X-ray consistent with old healed TB, or clients with organ transplants or immunosuppressed. An induration of greater than 10 millimeters is positive, and the client may be a recent arrival from high-prevalent countries, resident or an employee of high-risk congregate settings, or mycobacteriology lab personnel. persons with clinical conditions that place them at high risk, a child less than 4 years of age, or a child or adolescents exposed to adults in high-risk categories. The nurse teaches a client with heart failure to take oral furosemide in the morning. The primary reason for this is to help 1. Prevent electrolyte imbalances. 2. Slow rapid drug absorption. 3. Excrete excessive fluids accumulated during the night. 4. Prevent sleep disturbances during the night. The correct answer is 4. When diuretics are given early in the day, the client will void frequently during the daytime hours and will not need to void frequently during the night. Therefore, the client's sleep will not be disturbed. Taking furosemide in the morning has no effect on preventing electrolyte imbalances or slowing rapid drug absorption. The client should not accumulate excessive fluids throughout the night. When developing a discharge plan to manage the care of a client with chronic obstructive pulmonary disease, the nurse should advise the client to expect to 1. Develop respiratory infections easily. 2. Maintain current status. 3. Require less supplemental oxygen. 4. Show permanent improvement. The correct answer is 1. A client with COPD is at high risk for development of respiratory infections. COPD is slowly progressive. Therefore, maintaining current status and establishing a goal that the client will require less supplemental oxygen are unrealistic expectations. Treatment may slow progression of the disease, but permanent improvement is highly unlikely. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is teaching a client who has been diagnosed with tuberculosis how to avoid spreading the disease to family members. Which statement indicate that the client has understood the nurse's instructions? Select all that apply. 1. I will need to dispose of my old clothing when I return home. 2. I should always cover my mouth and nose when sneezing. 3. It is important that I isolate myself from family when possible. 4. I should use paper tissues to cough in and dispose of them promptly. 5. I can use regular plates and utensils whenever I eat. The correct answers are 2, 4, 5. When teaching the client how to avoid the transmission of tubercle bacilli, it is important for the client to understand that the organism is transmitted by droplet infection. Therefore, covering the mouth and nose when sneezing, using paper tissues to cough in with prompt disposal, and using regular plates and utensils indicate that the client has understood the nurse's instructions about preventing the spread of airborne droplets. It is not essential to discard clothing, nor does the client need to be isolated from family members. The nurse should assess the client for digoxin toxicity if serum levels indicate that the client has a 1. Low sodium level. 2. High glucose level. 3. High calcium level. 4. Low potassium level. The correct answer is 4. A low serum potassium level predisposes the client to digoxin toxicity. Because potassium inhibits cardiac excitability, a low serum potassium level would mean that the client will be prone to increased cardiac excitability. Sodium, glucose, and calcium levels do not affect digoxin or contribute to digoxin toxicity. Which of the following indicates that the client with chronic obstructive pulmonary disease who has been discharged to home understands the care plan? 1. The client promises to do pursed lip breathing at home. 2. The client states actions to reduce pain. 3. The client will use oxygen via a nasal cannula at 5 liters per minute. 4. The client agrees to call the physician if dyspnea on exertion increases. The correct answer is 4. Increasing dyspnea on exertion indicates that the client may be experiencing complications of COPD. Therefore, the nurse should notify the physician. Extracting promises from clients is not an outcome criterion. Pain is not a common symptom of COPD. Clients with COPD use low-flow oxygen supplementation to avoid suppressing the respiratory drive, which, for these clients, is stimulated by hypoxia. A client with tuberculosis is taking isoniazid, INH, to help prevent development of peripheral neuropathies. The nurse should instruct the client to 1. Adhere to a low cholesterol diet. 2. Supplement the diet with pyridoxine. 3. Get extra rest. 4. Avoid excessive sun exposure. The correct answer is 2. INH competes for the available vitamin B6 in the body and leaves the client at risk for development of neuropathies related to vitamin deficiency. Supplemental vitamin B6 is routinely prescribed. Following a low cholesterol diet, getting extra rest, and avoiding excessive sun exposure will not prevent the development of peripheral neuropathies. A client receiving a loop diuretic should be encouraged to eat which of the following foods? Select all that apply. 1. Angel food cake. 2. Banana. 3. Dried fruit. 4. Orange juice. 5. Peppers. The correct answers are 2, 3, and 4. Hypokalemia is a side effect of loop diuretics. Bananas, dried fruit, and oranges are examples of food high in potassium. Angel food cake, yellow cake, and peppers are low in potassium. When instructing clients on how to decrease the risk of chronic obstructive pulmonary disease, the nurse should emphasize which of the following? 1. Participate regularly in aerobic exercises. 2. Maintain a high-protein diet. 3. Avoid exposure to people with known respiratory infections. 4. Abstain from cigarette smoking. The correct answer is 4. Cigarette smoking is the primary cause of COPD. Other risk factors include exposure to environmental pollutants and chronic asthma. Participating in an aerobic exercise program, although beneficial, will not decrease the risk of COPD. Insufficient protein intake and exposure to people with respiratory infections do not increase the risk of COPD. Clients who have had active tuberculosis are at risk for recurrence. Which of the following conditions increases that risk? 1. Cool and damp weather. 2. Active exercise and exertion. 3. Physical and emotional stress. 4. Rest and inactivity. The correct answer is 3. Tuberculosis can be controlled but never completely eradicated from the body. Periods of intense physical or emotional stress increase the likelihood of recurrence. Clients should be taught to recognize the signs and symptoms of a potential recurrence. Weather and activity levels are not related to recurrences of tuberculosis. The nurse is admitting an older adult to the hospital. The echocardiogram report revealed left ventricular enlargement. The nurse notes 2+ pitting edema in the ankles when getting the client into bed. Based on this finding, what should the nurse do first? 1. Assess respiratory status. 2. Draw blood for laboratory studies. 3. Insert Foley catheter. 4. Weigh the client. The correct answer is 1. The ankle edema suggests fluid volume overload. The nurse should assess respiratory rate, lung sounds, and SpO2 to identify any signs of respiratory symptoms of heart failure requiring immediate attention. The nurse can then draw blood for laboratory studies, insert the Foley catheter, and weigh the client. Which of the following is a priority goal for the client with chronic obstructive pulmonary disease? 1. Maintaining functional ability. 2. Minimizing chest pain. 3. Increasing carbon dioxide levels in the blood. 4. Treating infectious agents. The correct answer is 1. A priority goal for client with COPD is to manage the signs and symptoms of the disease process so as to maintain the client's functional ability. Chest pain is not a typical symptom of COPD. The carbon dioxide concentration in the blood is increased to an abnormal level in clients with COPD. It would not be a goal to increase the level further. Preventing infection would be a goal of care for the client with COPD. A client who has been diagnosed with tuberculosis has been placed on drug therapy. The medication regimen includes rifampin. Which of the following instructions should the nurse include in the client's teaching plan related to the potential adverse effects of rifampin? Select all that apply. 1. Having eye examinations every 6 months. 2. Maintaining follow-up monitoring of liver enzymes. 3. decreasing protein intake in the diet. 4. Avoiding alcohol intake. 5. The urine may have an orange color. The correct answers are 2, 4, and 5. A potential adverse effect of rifampin is hepatotoxicity. Clients should be instructed to avoid alcohol intake while taking rifampin and keep follow-up appointments for periodic monitoring of liver enzyme levels to detect liver toxicity. Rifampin causes the urine to turn an orange color, and the client should understand that this is normal. It is not necessary to restrict protein intake in the diet or have the eyes examined due to rifampin therapy. A client has returned from the cardiac catheterization laboratory after a balloon valvuloplasty for mitral stenosis. Which of the following requires immediate nursing action? 1. A low, grade 1 intensity mitral regurgitation murmur. 2. SpO2 is 94% on 2 liters of oxygen via nasal cannula. 3. The client has become more somnolent. 4. Urine output has decreased from 60 milliliters per hour to 40 milliliters over the last hour. The correct answer is 3. A complication of balloon valvuloplasty is emboli resulting in a stroke. The client's increased drowsiness should be evaluated. Some degree of mitral regurgitation is common after the procedure. The oxygen status and urine output should be monitored closely, but do not warrant concern. When teaching a client with chronic obstructive pulmonary disease to conserve energy, the nurse should teach the client to lift objects. 1. While inhaling through an open mouth. 2. While exhaling through pursed lips. 3. After exhaling but before inhaling. 4. While taking a deep breath and holding it. The correct answer is 2. Exhaling requires less energy than inhaling. Therefore, lifting while exhaling saves energy and reduces perceived dyspnea. Pursing the lips prolongs exhalation and provides the client with more control over breathing. Lifting after exhaling, but before inhaling, is similar to lifting with the breath held. This should not be recommended because it is similar to the Valsalva maneuver, which can stimulate cardiac arrhythmias. The nurse caring for a 7-year-old child who has undergone a cardiac catheterization 2 hours ago finds the dressing and bed saturated with blood. The nurse should first 1. Assess the vital signs. 2. Reinforce the dressing. 3. Apply pressure just above the catheter insertion site. 4. Notify the primary healthcare provider. The correct answer is 3. Direct pressure is the first measure that should be used to control bleeding. Taking the vital signs will not control the bleeding. This should be done while another person is being sent to notify the primary healthcare provider. The dressing can be reinforced after the bleeding has been contained. A client with aortic stenosis has increasing dyspnea and dizziness. Identify the area where the nurse would place the stethoscope to assess a murmur from aortic stenosis. Choose option 1, 2, 3, 4, or 5 from the picture. The correct answer is option 1. The stethoscope is placed at the second intercostal space right of sternum to assess the aortic area as seen in option 1. Option 2 is a pulmonic valve area. Option 3 is Erb's point. Option 4 is a tricuspid valve area. And option 5 is the mitral valve area. The nurse assesses the respiratory status of a client who is experiencing an exacerbation of chronic obstructive pulmonary disease secondary to an upper respiratory tract infection. Which of the following findings would be expected? 1. Normal breath sounds. 2. Prolonged inspiration. 3. Normal chest movement. 4. Coarse crackles and rhonchi. The correct answer is 4. Exacerbations of COPD are commonly caused by respiratory infections. Coarse crackles and rhonchi will be auscultated as air moves through airways obstructed with secretions. In COPD, breath sounds are diminished because of an enlarged anteroposterior diameter of the chest. Expiration, not inspiration, becomes prolonged. Chest movement is decreased as lungs become overdistended. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When teaching the parents of a child with ventricular septal defect who is scheduled for a cardiac catheterization, the nurse explains that this procedure involves the use of which of the following? 1. Ultra-high frequency sound waves. 2. Catheter placed in the right femoral vein. 3. Cut-down procedure to place a catheter. 4. General anesthesia. The correct answer is 2. In children, cardiac catheterization usually involves a right-sided approach because septal defects permit entry into the left side of the heart. The catheter is usually inserted into the femoral vein through a percutaneous puncture. Echocardiography involves the use of ultra-high frequency sound waves. A cut-down procedure is rarely used. The catheterization is usually performed under local, not general, anesthesia with sedation. Which is the most important initial post-procedure nursing assessment for a client who has had a cardiac catheterization? 1. Monitor the laboratory values. 2. Observe neurologic function every 15 minutes. 3. Observe the puncture site for swelling and bleeding. 4. Monitor skin warmth and turgor. The correct answer is 3. Assessment of circulatory status, including observation of the puncture site, is of primary importance after a cardiac catheterization. Laboratory values and skin warmth and turgor are important to monitor, but are not the most important initial nursing assessment. Neurologic assessment every 15 minutes is not required. Which of the following diets would be most appropriate for a client with chronic obstructive pulmonary disease? 1. Low-fat, low-cholesterol diet. 2. Bland, soft diet. 3. Low-sodium diet. 4. High-calorie, high-protein diet. The correct answer is 4. The client should eat high-calorie, high-protein meals to maintain nutritional status and prevent weight loss that results from the increased work of breathing. The client should be encouraged to eat small, frequent meals. A low-fat, low-cholesterol diet is indicated for clients with coronary artery disease. The client with COPD does not necessarily need to follow a sodium-restricted diet, unless otherwise medically indicated. There is no need for client to eat bland, soft foods. Discharge teaching for a 3-month-old infant with a cardiac defect who is to receive digoxin should include which of the following? Select all that apply. 1. Give the medication at regular intervals. 2. Mix the medication with a small volume of breast milk or formula. 3. Repeat the dose one time if the child vomits immediately after administration. 4. Notify the primary care provider of poor feeding or vomiting. 5. Make up any missed doses as soon as realized. 6. Notify the primary care provider if more than 2 consecutive doses are missed. The correct answers are 1, 4, and 6. To achieve optimal therapeutic levels, digoxin should be given at regular intervals without variation, usually every 12 hours. Vomiting and poor feeding are signs of toxicity. If more than 2 consecutive doses are missed, interventions may be needed to assure therapeutic drug levels. The medication should not be mixed with any other fluid, as refusal may result in inaccurate intake of the medication. Taking make-up doses or taking the medication at times other than scheduled may adversely affect serum levels. A pulmonary artery catheter is inserted in a client with severe mitral stenosis and regurgitation. The nurse administers furosemide, Lasix, to treat pulmonary congestion and begins a nitroprusside, nipride, drip per physician prescriptions. The nurse notices a sudden drop in the pulmonary artery diastolic pressure and pulmonary artery wedge pressure. The nurse should first assess 1. 12-lead EKG. 2. Blood pressure. 3. Lung sounds. 4. Urine output. The correct answer is 2. The nurse should immediately assess the blood pressure since nipride and Lasix can cause severe hypotension from a decrease in preload and afterload. If the client is hypotensive, the nipride dose should be reduced or discontinued. Urine output should then be monitored to make sure there is adequate renal perfusion. A 12-lead EKG is performed if the client experiences chest pain. A reduction in pulmonary artery pressures should improve the pulmonary congestion and lung sounds. The nurse is planning to teach a client with chronic obstructive pulmonary disease how to cough effectively, which of the following instructions should be included. 1. Take a deep abdominal breath, bend forward, and cough 3 or 4 times on exhalation. 2. Lie flat on the back, splint the thorax, take 2 deep breaths, and cough. 3. Take several rapid, shallow breaths and then cough forcefully. 4. Assume a side-lying position, extend the arm over the head, and alternate deep breathing with coughing. The correct answer is 1. The goal of effective coughing is to conserve energy, facilitate removal of secretions, and minimize airway collapse. The client should assume a sitting position with feet on the floor if possible. The client should bend forward slightly and, using pursed lip breathing, exhale. After resuming an upright position, the client should use abdominal breathing to slowly and deeply inhale. After repeating this process 3 or 4 times, the client should take a deep abdominal breath, bend forward, and cough 3 or 4 times upon exhalation. Lying flat does not enhance lung expansion. Sitting upright promotes full expansion of thorax. Shallow breathing does not facilitate removal of secretions, and forceful coughing promotes collapse of airways. A side-lying position does not allow for adequate chest expansion to promote deep breathing. 12 hours after cardiac surgery, the nurse is assessing a 3-year-old who weighs 15 kilograms. The nurse should notify the surgeon about which of the following clinical findings. 1. A urine output of 60 milliliters in 4 hours. 2. Strong peripheral pulses in all 4 extremities. 3. Fluctuations of fluid in the collection chamber of the chest drainage system. 4. Alterations in levels of consciousness. The correct answer is 4. Clinical signs of low cardiac output and poor tissue perfusion include pale, cool extremities, cyanosis or mottled skin, delayed capillary refill, weak, thready pulses, oliguria, and alterations in level of consciousness. An adequate urine output for a child over 1 year should be 1 milliliter per kilogram per hour. Therefore, 60 milliliters per 4 hours is satisfactory. Strong peripheral pulses indicate adequate cardiac output. Drainage from the chest tube should show fluctuation in the drainage compartment of the chest drainage system. The fluid level normally fluctuates as proof that the apparatus is airtight. On about the 3rd postoperative day, the fluctuation ceases, indicating the lungs have fully expanded. In preparing the client and the family for a postoperative stay in the intensive care unit after open heart surgery, the nurse should explain that 1. The client will remain in the ICU for 5 days. 2. The client will sleep most of the time while in the ICU. 3. Noise and activity within the ICU are minimal. 4. The client will receive medication to relieve pain. The correct answer is 4. Management of postoperative pain is a priority for the client after surgery, including valve replacement surgery. The client and family should be informed that pain will be assessed by the nurse and medications will be given to relieve the pain. The client will stay in the ICU as long as monitoring and intensive care are needed. Sensory deprivation and overload, high noise levels, and disrupted sleep and rest patterns are some environmental factors that affect recovery from valve replacement surgery. A 34-year-old female with a history of asthma is admitted to the emergency department. The nurse notes that the client is dyspneic, with a respiratory rate of 35 breaths per minute, nasal flaring, and use of accessory muscles. Auscultation of the lung fields reveals greatly diminished breath sounds. Based on these findings, which action should the nurse take to initiate care of the client? 1. Initiate oxygen therapy as prescribed and reassess the client in 10 minutes. 2. Draw blood for an arterial blood gas. 3. Encourage the client to relax and breathe slowly through the mouth. 4. Administer bronchodilators as prescribed. The correct answer is 4. In an acute asthma attack, diminished or absent breath sounds can be an ominous sign indicating lack of air movement in the lungs and impending respiratory failure. The client requires immediate intervention with inhaled bronchodilators, IV corticosteroids, and possibly IV theophylline. Administering oxygen and reassessing the client 10 minutes later would delay needed medical intervention as with drawing blood for an arterial blood gas analysis. It would be futile to encourage the client to relax and breathe slowly without providing the necessary pharmacologic intervention. When teaching a preschool-age child how to perform coughing and deep breathing exercises before corrective surgery for tetralogy of Fallot, which of the following teaching and learning principles should the nurse address first? 1. Organizing information to be taught in a logical sequence. 2. Arranging to use actual equipment for demonstrations. 3. Building the teaching on the child's current level of knowledge. 4. Presenting the information in order from simplest to most complex. The correct answer is 3. Before developing any teaching program for a child, the nurse's first step is to assess the child to determine what is already known. Most older preschool children have some understanding of a condition present since birth. However, the child's interest will soon be lost if familiar material is repeated too often. The nurse can then organize the information in a sequence because there are several steps to be demonstrated. These exercises do not require the use of equipment. The nurse should judge the amount and complexity of the information to be provided based on the child's current knowledge and response to teaching. The most effective measure the nurse can use to prevent wound infection when changing a client's dressing after coronary artery bypass surgery is to 1. Observe careful hand washing procedures. 2. Clean the incisional area with an antiseptic. 3. Use pre-packaged sterile dressings to cover the incision. 4. Place soil dressings in a waterproof bag before disposing of them. The correct answer is 1. Many factors help prevent wound infections, including washing hands carefully, using sterile pre-packaged supplies and equipment, cleaning the incisional area well, and disposing of soil dressings properly. However, most authorities say that the single most effective measure in preventing wound infections is to wash the hands carefully before and after changing dressings. Careful hand washing is also important in reducing other infections often acquired in hospitals, such as urinary tract and respiratory tract infections. A client with acute asthma is prescribed short-term corticosteroid therapy. Which is the expected outcome for the use of steroids in clients with asthma? 1. Promote bronchodilation. 2. Act as an expectorant. 3. Have an anti-inflammatory effect. 4. Prevent development of respiratory infections. The correct answer is 3. Corticosteroids have an anti-inflammatory effect and act to decrease edema in the bronchial airways and decrease mucus secretion. Corticosteroids do not have a bronchodilator effect, act as expectorants, or prevent respiratory infections. Which of the following is the greatest priority for the therapeutic management of a child with congestive heart failure, CHF, caused by pulmonary stenosis? 1. Educating the family about the signs and symptoms of infection. 2. Administering enoxaparin to improve left ventricular contractility. 3. Assessing heart rate and blood pressure every 2 hours. 4. Administrating furosemide to decrease systemic venous congestion. The correct answer is 4. Pulmonary stenosis can cause right-sided CHF, resulting in venous congestion. Removing accumulated fluid is a primary goal of treatment in right-sided CHF. Lasix is used to reduce venous congestion. It is important to educate the family about signs and symptoms of CHF, but treating the client's CHF is a priority. Lovenox is an anticoagulant and will not help improve left ventricular contractility. It is important to assess vital signs frequently in the child with CHF, but assessments do not treat the problem. The nurse should teach the client who is receiving warfarin sodium that 1. Partial thromboplastin time values determine the dosage of warfarin sodium. 2. Protamine sulfate is used to reverse the effects of warfarin sodium. 3. International normalized ratio is used to assess effectiveness. 4. Warfarin sodium will facilitate clotting of the blood. The correct answer is 3. INR is a value used to assess effectiveness of the warfarin sodium therapy. Partial thromboplastin time is used to assess the effectiveness of heparin therapy. Fresh frozen plasma or vitamin K is used to reverse warfarin sodium's anticoagulant effect, whereas protamine sulfate reverses the effects of heparin. Warfarin sodium will help to prevent blood clots. A client is prescribed metoprolol via a metered-dose inhaler, 2 puffs every 4 hours. The nurse instructs the client to report adverse effects. Which of the following are potential adverse effects of metoprolol? 1. Irregular heartbeat. 2. Constipation. 3. Pedal edema. 4. Decreased pulse rate. The correct answer is 1. Irregular heartbeat should be reported promptly to the care provider. Metoprolol may cause irregular heartbeat, tachycardia, or inguinal pain because of its adrenergic effect on beta-adrenergic receptors in the heart. It is not recommended for use in clients with known cardiac disorders. Metoprolol does not cause constipation, pedal edema, or bradycardia. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A child has had open heart surgery to repair a tetralogy of Fallot with a patch. The nurse should instruct the parents to 1. Notify all healthcare providers before invasive procedures for the next 6 months. 2. Maintain adequate hydration of at least 10 glasses of water a day. 3. Provide for frequent rest periods and naps during the first 4 weeks. 4. Restrict the ingestion of bananas and citrus fruit. The correct answer is 1. Children who have undergone open heart surgery with a patch are at risk for infection, especially subacute bacterial endocarditis, SBE, for the first 6 months following surgery. The newest evidence-based guidelines suggest that once the patch has epithelialized, these precautions are no longer necessary. Therefore, parents are instructed about SBE precautions, including the need to notify providers before invasive procedures so antibiotics can be prescribed for that time period. Having the child drink a very large amount of water may lead to fluid overload. Children gear their rest schedule to their activities, making it unnecessary to schedule frequent rest periods. Bananas and citrus fruit are high in potassium, but there is no evidence provided that the child has an elevated serum potassium requiring restriction. Before a client's discharge after mitral valve replacement surgery, the nurse should evaluate the client's understanding of post-surgery activity restrictions. Which of the following should the client not engage in until after the 1-month post-discharge appointment with the surgeon? 1. Showering. 2. Lifting anything heavier than 10 pounds. 3. A program of gradually progressive walking. 4. Light housework. The correct answer is 2. Most cardiac surgical clients have median sternotomy incisions, which take about 3 months to heal. Measures that promote healing include avoiding heavy lifting, performing muscle reconditioning exercises, and using caution when driving. Showering or bathing is allowed as long as the incision is well approximated with no open areas or drainage. Activities should be gradually resumed on discharge. A nurse is teaching a client to use a metered dose inhaler to administer bronchodilator medication. Indicate the correct order of the steps the client should take to use the MDI appropriately. 1. Shake the inhaler immediately before use. 2. Hold breath for 5 to 10 seconds and then exhale. 3. Activate the MDI on inhalation. 4. Breathe out through the mouth. The correct order is 1, 4, 3, and 2. When using inhalers, clients should first shake the inhaler to activate the MDI, and then breathe out through the mouth. Next, the client should activate the MDI while inhaling, hold the breath for 5 to 10 seconds, and then exhale normally. After surgery to correct the tetralogy of Fallot, the child's parents express concern to the nurse that their 4-year-old child wants to be held more frequently than usual. The nurse recommends 1. Introducing a new skill. 2. Play therapy. 3. Encouraging behavior. 4. Having the volunteer hold the child. The correct answer is 2. The child is exhibiting regression. During periods of stress, children frequently revert to behaviors that were comforting in earlier developmental stages. Play therapy is one way to help the child cope with the stress. Teaching a new skill most likely would add more stress. Parents should be instructed to praise positive behaviors and ignore regressive behaviors rather than calling attention to them through encouragement or discouragement. Having someone else hold the child does not encourage coping with the stress or promoting appropriate development. Postoperative nursing management of the client following a radical neck dissection for laryngeal cancer requires 1. Complete bed rest minimizing head movement. 2. Vital signs once a shift. 3. Clear liquid diet started at 48 hours. 4. Frequent suctioning of the laryngectomy tube. The correct answer is 4. The nurse must maintain patency of the airway with frequent suctioning of the laryngectomy tube that can become occluded from secretions, blood, and mucus plugs. Once the client is hemodynamically stable, getting out of bed should be encouraged to prevent postoperative complications. Vital signs should be monitored more frequently in a postoperative client. A swallow study is done at approximately 5 to 7 days after surgery, prior to starting oral intake. Which of the following health promotion activities should the nurse include in the discharge teaching plan for a client with asthma? 1. Incorporate physical exercise as tolerated into the daily routine. 2. Monitor peak flow numbers after meals and at bedtime. 3. Eliminate stressors in the work and home environment. 4. Use sedatives to ensure uninterrupted sleep at night. The correct answer is 1. Physical exercise is beneficial and should be incorporated as tolerated into the client's schedule. Peak flow numbers should be monitored daily, usually in the morning. Peak flow does not need to be monitored after each meal. Stressors in the client's life should be modified but cannot be totally eliminated, although adequate sleep is important. It is not recommended that sedatives be routinely taken to induce sleep. A laboring client with preeclampsia is prescribed magnesium sulfate 2 grams per hour IV piggyback. The pharmacy sends the IV to the unit, labeled magnesium sulfate 20 grams per 500 milliliters normal saline, to deliver the correct dose. The nurse should set the pump to deliver how many milliliters per hour? Blank ml. The correct answer is 50 milliliters. You set up the formula as 500 milliliters over 20 grams multiply by x over 2 grams. You cross multiply and get 1,000 equals 20x. You divide 1,000 on both sides and you get x equals 50. The nurse is suctioning a client who had a laryngectomy. What is the maximum amount of time the nurse should suction the client? 1. 10 seconds. 2. 30 seconds. 3. 45 seconds. 4. 60 seconds. The correct answer is 1. A client should be suctioned for no longer than 10 seconds at a time. Suctioning for longer than 10 seconds may reduce the client's oxygen levels so much that he becomes hypoxic. Which of the following findings would most likely indicate the presence of a respiratory infection in a client with asthma? 1. Cough productive of yellow sputum. 2. Bilateral expiratory wheezing. 3. Chest tightness. 4. Respiratory rate of 30 breaths per minute. The correct answer is 1. A cough productive of yellow sputum is the most likely indicator of a respiratory infection. The other signs and symptoms, wheezing, chest tightness, and increased respiratory rate, are all findings associated with an asthma attack and do not necessarily mean an infection is present. The nurse is instructing a preeclamptic client about monitoring the movements of her fetus to determine fetal well-being. Which statement by the client indicates that she needs further instruction about when to call the healthcare provider concerning fetal movement? 1. If the fetus is becoming less active than before. 2. If it takes longer each day for the fetus to move 10 times. 3. If the fetus stops moving for 12 hours. 4. If the fetus moves more often than 3 times an hour. The correct answer is 4. The fetus is considered well if it moves more often than 3 times in 1 hour. Daily fetal movement counting is part of all high-risk assessments and is a non-invasive, inexpensive method of monitoring fetal well-being. The healthcare provider should be notified if there's a gradual slowing over time of fetal activity, if each day it takes longer for the fetus to move a minimum of 10 times, or the fetus stops moving for 12 hours or longer. The client with a laryngectomy does not want his family to see him. He indicates that he thinks the opening in his throat is disgusting. The nurse should 1. Initiate teaching about the care of a stoma. 2. Explain that the stoma will not always look as it does now. 3. Inform the client of the benefits of family support at this time. 4. Explore why the client believes the stoma is disgusting. The correct answer is 4. Changes in body image are expected after laryngectomy, and the nurse should first explore what is upsetting the client the most at this time. Many clients are concerned about how their family members will respond to the physical changes that have occurred as a result of a laryngectomy, but discussing the importance of family support is not helpful. Instead, the nurse should allow the client to communicate any negative feelings or concerns that exist because of the surgery. The client's feelings are not related to a knowledge deficit, and therefore, it is too early to begin teaching about stoma care. It is also not helpful to offer reassurances about the change in appearance. The client will require time to adjust to the changed body image. The nurse is caring for a client who has asthma. The nurse should conduct a focus assessment to detect which of the following: 1. Increased forced expiratory volume. 2. Normal breath sounds. 3. Inspiratory and expiratory wheezing. 4. Morning headaches. The correct answer is 3. The hallmark signs of asthma are chest tightness, audible wheezing, and coughing. Inspiratory and expiratory wheezing is the result of bronchoconstriction. Even between exacerbations, there may be some soft wheezing, so a finding of normal breath sounds would be expected in the absence of asthma. The expected finding is decreased forced expiratory volume due to bronchoconstriction. Morning headaches are found in more advanced cases of COPD signal nocturnal hypercapnia or hypoxemia. At 32 weeks gestation, a 15-year-old premigravida client who is 5 feet, 2 inches has gained a total of 20 pounds, with a 1 pound gain in the last 2 weeks. Urinalysis reveals negative glucose and a trace of protein. The nurse should advise the client that which of the following factors increases her risk for preeclampsia: 1. Total weight gain. 2. Short stature. 3. Adolescent age group. 4. Proteinuria. The correct answer is 3. Clients with increased risk for preeclampsia include primigravida clients younger than 20 years or older than 40 years, clients with 5 or more pregnancies, women of color, women with multi-field pregnancies, women with diabetes or heart disease, and women with hydramnios. A total weight gain of 20 pounds at 32 weeks gestation, with a 1 pound weight gain in the last 2 weeks, is within normal limits. Short stature is not associated with the development of preeclampsia. A trace amount of protein in the urine is common during pregnancy. However, protein amounts of 1+ or more may be a symptom of pregnancy-induced hypertension. What areas of education should the nurse provide employees in a factory making products that cause respiratory irritation to reduce the risk of laryngeal cancer? Select all that apply. 1. Stopping smoking. 2. Using a HEPA filter in the home. 3. Limiting alcohol intake. 4. Brushing teeth after every meal. 5. Avoiding raising the voice to be heard over the noise in the factory. The correct answers are 1 and 3. The primary risk factors for laryngeal cancer are smoking and alcohol intake. Smoking cessation is most successful with a support group or counseling. Heavy drinking should be avoided since the risk increases with the amount of alcohol consumption. HEPA filters help trap small particles and allergens to reduce allergy symptoms and asthma. Poor oral hygiene is not a risk factor, nor is overusing the voice. A 12-year-old with rheumatic fever has a history of long-term aspirin use, which statement by the client indicates that the nurse should notify the healthcare provider. 1. I hear ringing in my ears. 2. I put lotion on my itchy skin. 3. My stomach hurts after I take that medicine. 4. These pills make me cough. The correct answer is 1. Tinnitus is an adverse effect of prolonged aspirin therapy, and the child should be examined by a healthcare provider for hearing loss. Itchy skin commonly accompanies a rash associated with rheumatic fever, and the nurse can encourage lotion use. The nurse teaches clients to take aspirin with food or milk to avoid abdominal discomfort. The nurse can also address the fact that coughing after ingesting aspirin can be caused by inadequate fluid intake during administration. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. After instructing a multigravida client diagnosed with mild preeclampsia how to keep a record of fetal movement patterns at home, the nurse determines that the teaching has been effective when the client says that she will count the number of times the baby moves during which of the following time spans. 1. 30-minute period 3 times a day. 2. 45-minute period after lunch each day. 3. 1-hour period each day. 4. 12-hour period each week. The correct answer is 3. Numerous methods have been proposed to record the maternal perceptions of fetal movement, or kick counts. A commonly used method is the Cardiff count to 10 method. The client begins counting fetal movements at a specified time and notes the time when the 10th movement is felt. If the client does not feel at least 6 movements in a 1-hour period, she should notify the healthcare provider. The fetus typically moves an average of 1 to 2 times every 10 minutes, or 10 to 12 times per hour. A 30 or 45-minute period is not enough time to evaluate fetal movement accurately. The client should monitor fetal movements more frequently than 1 time per week. 1 hour of monitoring each day is adequate. A client has just returned from the post-anesthesia care unit after undergoing a laryngectomy. Which of the following interventions should the nurse include in the plan of care? 1. Maintain the head of the bed at 30 to 40 degrees. 2. Teach the client how to use esophageal speech. 3. Initiate small feedings of soft foods. 4. Irrigate drainage tubes as needed. The correct answer is 1. Immediately after surgery, the client should be maintained in position with the head of the bed elevated 30 to 40 degrees to decrease tissue edema, facilitate breathing, and decrease pain related to edema formation. Immediately post-operatively, the client should be provided alternative means of communicating, such as a communication board. As healing progresses and edema subsides, a speech therapist should work with the client to explore various voice restoration options, such as the use of a voice prosthesis, electrolarynx, artificial larynx, or esophageal speech. Food is not initiated in the immediate postoperative phase. Enteral feedings are usually used to meet nutritional needs until edema subsides. Irrigation of the drainage tubes is an inappropriate action. Which of the following initial physical findings indicate the development of carditis in a child with rheumatic fever? 1. Heart murmur. 2. Low blood pressure. 3. Irregular pulse. 4. Anterior chest wall pain. The correct answer is 1. In rheumatic fever, the connective tissue of the heart becomes inflamed, leading to carditis. The most common signs of carditis are heart murmurs, tachycardia during rest, cardiac enlargement, and changes in the electrical conductivity of the heart. Heart murmurs are present in about 75% of all clients during the first week of carditis, and in 85% of clients by the 3rd week. Signs of carditis do not include hypotension or chest pain. The client may have a rapid pulse, but it is usually not irregular. A 17-year-old client at 33 weeks gestation diagnosed with mild preeclampsia is treated as an outpatient. The nurse instructs the client to contact a healthcare provider immediately if she experiences which of the following? 1. Blurred vision. 2. Ankle edema. 3. Increased energy levels. 4. Mild backache. The correct answer is 1. Severe headache, visual disturbances, such as blurred vision, and epigastric pain are associated with the development of severe preeclampsia and possibly eclampsia. These danger signs and symptoms must be reported immediately. Severe headache and visual disturbances are related to severe vasoconstriction and a severe increase in blood pressure. Epigastric pain is related to hepatic dysfunction. Ankle edema is common during the third trimester. However, facial edema is associated with increased fluid retention and the progression from mild to severe preeclampsia. Increased energy levels are not associated with the progression of the client's preeclampsia or the development of complications. In fact, some women report an energy spurt before the onset of labor. Mild backache is a common discomfort pregnancy, unrelated to progression of the client's preeclampsia. It also may be associated with bed rest when the mattress is not firm. Some multiparous women have reported a mild backache as a sign of impending labor. Which of the following home care instructions would be appropriate for a client with a laryngectomy? 1. Perform mouth care every morning and evening. 2. Provide adequate humidity in the home. 3. Maintain a soft, bland diet. 4. Limit physical activity to shoulder and neck exercises. The correct answer is 2. Adequate humidity should be provided in the home to help keep secretions moist. A bedside humidifier is recommended. A high fluid intake is also important to liquefy secretions. Mouth care is important to prevent drying of mucous membranes and should be performed frequently throughout the day, especially before and after meals, to help stimulate appetite. The client may eat any food that can be chewed and swallowed comfortably. The client may resume physical activity as tolerated. Which of following should the nurse perform to help alleviate a child's joint pain associated with rheumatic fever? 1. Maintaining the joints in an extended position. 2. Applying gentle traction to the child's affected joints. 3. Supporting proper alignment with rolled pillows. 4. Using a bed cradle to avoid the weight of bed linens on joints. The correct answer is 4. For a child with arthritis associated with rheumatic fever, the joints are usually so tender that even the weight of bed linens can cause pain. Use of a bed cradle is recommended to help remove the weight of the linens on painful joints. Joints need to be maintained in good alignment, not positioned in extension, to ensure that they remain functional. Applying gentle traction to the joints is not recommended because traction is usually used to relieve muscle spasms, not typically associated with rheumatic fever. Supporting the body in good alignment and changing the client's position are recommended, but these measures are not likely to relieve pain. When preparing the room for admission of a multigravida client at 36 weeks gestation diagnosed with severe preeclampsia, which of the following should the nurse obtain? 1. Oxytocin infusion solution. 2. Disposable tongue blades. 3. Portable ultrasound machine. 4. Padding for the side rails. The correct answer is 4. The client with severe preeclampsia may develop eclampsia, which is characterized by seizures. The client needs a darkened, quiet room and side rails with thick padding. This helps decrease the potential for injury should a seizure occur. Airways, suction machine, and oxygen also should be available. If the client is to undergo induction of labor, oxytocin infusion solution can be obtained at a later time. Tongue blades are not necessary. However, the emergency cart should be placed nearby in case the client experiences a seizure. The ultrasound machine may be used at a later point to provide information about the fetus. In many hospitals, the client with severe preeclampsia is admitted to the labor area, where she and the fetus can be closely monitored. The safety of the client and her fetus is the priority. An elderly client admitted with pneumonia and dementia has attempted several times to pull out the IV and Foley catheter. The nurse obtains a prescription for bilateral soft wrist restraints. Which nursing action is most appropriate? 1. Perform circulation checks to bilateral upper extremities each shift. 2. Attach the ties of the restraints to the bed frame. 3. Reevaluate the need for restraints and document weekly. 4. Ensure the restraint order has been signed by the physician within 72 hours. The correct answer is 2. Restraints should be secured to the bed frame, not the side rails, to ensure that the side rails can be raised and lowered safely. Circulation checks, reevaluating need for restraints, and documentation should be done every 1 to 2 hours. Medical restraint prescriptions must be renewed and signed by a physician every 24 hours. A child with Kawasaki disease is receiving low-dose aspirin. The mother calls a clinic and states that the child has been exposed to influenza. Which recommendations should the nurse make? Select all that apply. 1. Increase fluid intake. 2. Stop the aspirin. 3. Keep the child home from school. 4. Watch for fever. 5. Weigh the child daily. The correct answers are 2 and 4. Aspirin needs to be stopped because of its possible link to Rice syndrome. Additionally, the parents need to watch for signs and symptoms of influenza. Children with influenza, frequently present with fever, cold symptoms, and gastrointestinal symptoms. Increasing the child's fluid intake and weighing the child daily are not needed at this time because the child is not ill. Keeping the child home from school is not necessary because the child is not ill and has already been exposed. For the client who is receiving intravenous magnesium sulfate for severe preeclampsia, which the following assessment findings would alert the nurse to suspect hypermagnesemia. 1. Decreased deep tendon reflexes. 2. Cool skin temperature. 3. Rapid pulse rate. 4. Tingling in the toes. The correct answer is 1. Typical signs of hypermagnesemia include decreased deep tendon reflexes, sweating or flushing of the skin, oliguria, decreased respirations, and lethargy progress into coma as the toxicity increases. The nurse should check the client's patellar, biceps, and radial reflexes regularly during magnesium sulfate therapy. Cool skin temperature may result from peripheral vasodilation, but the opposite, flushing and sweating, are usually seen. A rapid pulse rate commonly occurs in hypomagnesemia. Tingling in the toes may suggest hypocalcemia, not hypermagnesemia. Which of the following are significant data to gather from a client who has been diagnosed with pneumonia? Select all that apply. 1. Quality of breath sounds. 2. Presence of bowel sounds. 3. Occurrence of chest pain. 4. Amount of peripheral edema. 5. Color of nail beds. The correct answers are 1, 3, and 5. A respiratory assessment, which includes auscultating breath sounds and assessing the color of the nail beds, is a priority for clients with pneumonia. Assessing for the presence of chest pain is also an important respiratory assessment, as chest pain can interfere with the client's ability to breathe deeply. Auscultating bowel sounds and assessing for peripheral edema may be appropriate assessments, but these are not priority assessments for a client with pneumonia. A client with bacterial pneumonia is to be started on IV antibiotics. Which of the following diagnostic tests must be completed before antibiotic therapy begins? 1. Urinalysis. 2. Sputum culture. 3. Chest radiograph. 4. Red blood cell count. The correct answer is 2. A sputum specimen is obtained for culture to determine the causative organism. After the organism is identified, an appropriate antibiotic can be prescribed. Beginning antibiotic therapy before obtaining the sputum specimen may alter the results of the test. Urinalysis, a chest radiograph, and a red blood cell count do not need to be obtained before initiation of antibiotic therapy for pneumonia. When caring for the client who is receiving an aminoglycoside antibiotic, the nurse should monitor which of the following laboratory values. 1. Serum sodium. 2. Serum potassium. 3. Serum creatinine. 4. Serum calcium. The correct answer is 3. It is essential to monitor serum creatinine in the client receiving an aminoglycoside antibiotic because of the potential of this type of drug to cause acute tubular necrosis. Aminoglycoside antibiotics do not affect serum sodium, potassium, or calcium levels. Penicillin has been prescribed for a client admitted to the hospital for treatment of pneumonia. Prior to administering the first dose of penicillin, the nurse should ask the client, 1. Do you have a history of seizures? 2. Do you have any cardiac history? 3. Have you had any recent infections? 4. Have you had a previous allergy to penicillin? The correct answer is 4. The nurse should determine if the client is allergic to penicillin prior to administering the drug. History of seizures, recent infections, and a cardiac history are not contraindications for this client for receiving penicillin. While it is important to know, recent infections will not preclude this client receiving penicillin at this time. A client with pneumonia has a temperature of 102.6 degrees Fahrenheit, is diaphoretic, and has a productive cough. The nurse should include which of the following measures in the plan of care? 1. Position changes every 4 hours. 2. Nasotracheal suctioning to clear secretions. 3. Frequent linen changes. 4. Frequent offering of a bedpan. The correct answer is 3. Frequent linen changes are appropriate for this client because of the diaphoresis. Diaphoresis produces general discomfort. The client should be kept dry to promote comfort. Position changes need to be done every 2 hours. Nasotracheal suctioning is not indicated with the client's productive cough. Frequent offering of a bedpan is not indicated by the data provided in this scenario. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Bed rest is prescribed for a client with pneumonia during the acute phase of the illness. The nurse should determine the effectiveness of bed rest by assessing the clients. 1. Decreased cellular demand for oxygen. 2. Reduced episodes of coughing. 3. Diminished pain when breathing deeply. 4. Ability to expectorate secretions more easily. The correct answer is 1. Exudate in the alveoli interferes with ventilation and the diffusion of gases in clients with pneumonia. During the acute phase of the illness, it is essential to reduce the body's need for oxygen at the cellular level. Bed rest is the most effective method for doing so. Bed rest does not decrease coughing or promote clearance of secretions, and it does not reduce pain when taking deep breaths. The cyanosis that accompanies bacterial pneumonia is primarily caused by which of the following? 1. Decreased cardiac output. 2. Pleural effusion. 3. Inadequate peripheral circulation. 4. Decreased oxygenation of the blood. The correct answer is 4. A client with pneumonia has less lung surface available for the diffusion of gases because of the inflammatory pulmonary response that creates lung exudate and results in reduced oxygenation of the blood. The client becomes cyanotic because blood is not adequately oxygenated in the lungs before it enters the peripheral circulation. Decreased cardiac output may be a comorbid condition in some clients with pneumonia. However, it is not the cause of cyanosis. Pleural effusions are a potential complication of pneumonia, but are not the primary cause of decreased oxygenation. Inadequate peripheral circulation is also not the cause of the cyanosis that develops with bacterial pneumonia. A client with pneumonia is experiencing pleuritic chest pain. The nurse should assess the client for 1. A mild but constant aching in the chest. 2. Severe midsternal pain. 3. Moderate pain that worsens on inspiration. 4. Muscle spasm pain that accompanies coughing. The correct answer is 3. Chest pain in pneumonia is generally caused by friction between the pleural layers. It is more severe on inspiration than on expiration, secondary to chest wall movement. Pleuritic chest pain is usually described as sharp, not mild or aching. Pleuritic chest pain is not localized to the sternum, and it is not the result of a muscle spasm. Which of the following measures would most likely be successful in reducing pleuritic chest pain in a client with pneumonia? 1. Encourage the client to breathe shallowly. 2. Have the client practice abdominal breathing. 3. Offer the client incentive spirometry. 4. Teach the client to splint the rib cage when coughing. The correct answer is 4. The pleuritic pain is triggered by chest movement and is particularly severe during coughing. Splinting the chest wall will help reduce the discomfort of coughing. Deep breathing is essential to prevent further atelectasis. Abdominal breathing is not as effective in decreasing pleuritic chest pain as a splinting of the rib cage. Incentive spirometry facilitates effective deep breathing, but does not decrease pleuritic chest pain. The nurse administers 325 milligrams aspirin every 4 hours to a client with pneumonia. The nurse should evaluate the outcome of administering the drug by assessing which of the following? Select all that apply. 1. Decrease pain when breathing. 2. Prolonged clotting time. 3. Decreased temperature. 4. Decreased respiratory rate. 5. Increased ability to expectorate secretions. The correct answers are 1 and 3. Aspirin is administered to clients with pneumonia because it is an analgesic that helps control chest discomfort and an antipyretic that helps reduce fever. Aspirin has an anticoagulant effect, but that is not the reason for prescribing it for a client with pneumonia, and the use of the drug will be short-term. Aspirin does not affect the respiratory rate and does not facilitate expectoration of secretions. Which of the following mental status changes may occur when a client with pneumonia is first experiencing hypoxia? 1. Coma. 2. Apathy. 3. Irritability. 4. Depression. The correct answer is 3. Clients who are experiencing hypoxia characteristically exhibit irritability, restlessness, or anxiety as initial mental status changes. As the hypoxia becomes more pronounced, the client may become confused and combative. Coma is a late clinical manifestation of hypoxia. Apathy and depression are not symptoms of hypoxia. The client with pneumonia develops mild constipation, and the nurse administers docusate sodium as prescribed. This drug works by 1. Softening the stool. 2. Lubricating the stool. 3. Increasing stool bulk. 4. Stimulating peristalsis. The correct answer is 1. Docusate sodium is a stool softener that allows fluid and fatty substances to enter the stool and soften it. Docusate sodium does not lubricate the stool, increase stool bulk, or stimulate peristalsis. The unlicensed assistive personnel reports to the nurse that a client admitted with pneumonia is very diaphoretic. The nurse reviews the following vital signs in the chart obtained by the UAP. The nurse should do which of the following? Select all that apply. 1. Assure the client is maintaining complete bed rest. 2. Check the urine output. 3. Ask the client to drink more fluids. 4. Notify the physician. 5. Administer acetaminophen as prescribed. Pause the video if needed and look at the chart. The correct answers are 2, 3, and 5. A client with pneumonia experiencing diaphoresis is at risk for dehydration and increased temperature and heart rate. The fluid status intake and urine output should be monitored closely. The client is febrile, causing increase in heart rate. Fluid volume deficit may also increase the heart rate. The underlying cause of the tachycardia can be treated with acetaminophen and increased intake of fluids. Bed rest limits lung expansion, and sitting up and deep breathing should be encouraged in a client with pneumonia. The blood pressure is stable enough to allow the client to get out of bed to the chair, with assistance to ensure safety. It is not necessary to notify the physician. Which of the following is an expected outcome for an elderly client following treatment for bacterial pneumonia? 1. A respiratory rate of 25 to 30 breaths per minute. 2. The ability to perform activities of daily living without dyspnea. 3. A maximum loss of 5 to 10 pounds of body weight. 4. Chest pain that is minimized by splinting the rib cage. The correct answer is 2. An expected outcome for a client recovering from pneumonia would be the ability to perform activities of daily living without experiencing dyspnea. A respiratory rate of 25 to 30 breaths per minute indicates the client is experiencing tachypnea, which would not be expected on recovery. A weight loss of 5 to 10 pounds is undesirable. The expected outcome would be to maintain normal weight. A client who is recovering from pneumonia should experience decreased or no chest pain. The nurse is inspecting the child's throat. The nurse should 1. Remove the tongue blade from the child's hands after he has experienced what it feels like in his mouth. 2. Ask the child to hold the tongue blade with both hands in his lap, while the nurse uses another tongue blade. 3. Have the parent hold the child with arms restrained. 4. Guide the tongue blade while the child is holding it to depress the tongue to visualize the throat. The correct answer is 4. If the child does not stick out his tongue so the nurse can visualize the throat, it is appropriate to use a tongue blade. Having the child participate by holding the tongue blade while the nurse guides it to facilitate visualization of the throat is appropriate technique. It is not useful to remove the tongue blade or have the child hold it because the nurse will need to use the tongue blade to depress the tongue. It is preferable to engage the child's cooperation before asking the parent to restrain the child. The nurse has identified a problem of anxiety. For a 4-year-old preparing for a tonsillectomy, the nurse should tell the child, 1. You won't have so many sore throats after your tonsils are removed. 2. The doctor will put you to sleep so you don't feel anything. 3. Show me how to get a doll an IV. 4. When it is done, you'll get to see your mommy and get a popsicle. The correct answer is 4. When preparing a child for a procedure, the nurse should use neutral words, focus on sensory experiences, and emphasize the positive aspects at the end. Being reunited with parents and having an ice pop will be considered pleasurable events. Children this age fear bodily harm. To reduce anxiety, the nurse should use the word fixed instead of removed to describe what is being done to the tonsils. Using the terms put to sleep and IV may be threatening. Additionally, directing a play experience to focus on IV insertion may be counterproductive as the child may have little recollection of this aspect of the procedure. After a tonsillectomy and adenodectomy, which the following findings should alert the nurse to suspect early hemorrhage in a 5-year-old child. 1. Drooling of bright red secretions. 2. Pulse rate of 95 beats per minute. 3. Vomiting of 25 milliliters of dark brown emesis. 4. Blood pressure of 95/56. The correct answer is 1. After a tonsillectomy and adenodectomy, drooling bright red blood is considered an early sign of hemorrhage. Often, because of discomfort in the throat, children tend to avoid swallowing. Instead, they drool. Frequent swallowing would also be an indication of hemorrhage because the child attempts to clear the airway of blood by swallowing. Secretions may be slightly blood-tinged because of a small amount of oozing after surgery. However, bright red secretions indicate bleeding. A pulse rate of 95 beats per minute is within the normal range for a 5-year-old child, as is a blood pressure of 95/56. A small amount of blood that is partially digested and therefore dark brown is often present in postoperative emesis. After teaching the parents of a preschooler who has undergone a tonsillectomy and adenodectomy about appropriate foods to give a child after discharge, which of the following is stated by the parents as appropriate foods, indicate successful teaching? 1. Meatloaf and uncooked carrots. 2. Pork and noodle casserole. 3. Cream of chicken soup and orange sherbet. 4. Hot dog and potato chips. The correct answer is 3. For the first few days after a tonsillectomy and adenoidectomy, liquids and soft foods are best tolerated by the child while the throat is sore. Children typically do not chew their food thoroughly, and solid foods are to be avoided because they are difficult to swallow. Although meatloaf would be considered a soft food, uncooked carrots would not be. Pork is frequently difficult to chew. Foods that have sharp edges, such as potato chips, are contraindicated because they are hard to chew and may cause more throat discomfort. A nurse is teaching the parents of a preschooler about the possibility of postoperative hemorrhage after a tonsillectomy and adenoidectomy. The nurse should explain that the risk is greatest at which of the following times? 1. 1 to 3 days after surgery. 2. 4 to 6 days after surgery. 3. 7 to 10 days after surgery. 4. 11 to 14 days after surgery. The correct answer is 3. The risk of hemorrhage from a tonsillectomy is greatest when the tissue begins sloughing and the scabs fall off. This typically happens 7 to 10 days after a tonsillectomy. An adolescent female is prescribed amoxicillin, Amoxil, for an ear infection. The nurse should teach the adolescent about the risks associated with her concurrent use of 1. Antacids, 2. Oral contraceptives, 3. Multiple vitamins, 4. Protein shakes. The correct answer is 2. When a person is taking amoxicillin as well as an oral contraceptive, it renders the contraceptive less effective. Because pregnancy can occur in such a situation, the nurse should advise the client to use additional means of birth control during the time she is taking the antibiotic. There are no risks associated with the concurrent use of amoxicillin and antacids, vitamins, or protein shakes. A toddler is scheduled to have tympanostomy tubes inserted. When approaching the toddler for the first time, which of the following should the nurse do? 1. Talk to the mother first so that the toddler can get used to the new person. 2. Hold the toddler so that the toddler becomes more comfortable. 3. Walk over and pick the toddler up right away so that the mother can relax. 4. Pick up the toddler and take the child to play area so that the mother can rest. The correct answer is 1. Toddlers should be approached slowly because they are wary of strangers and need time to get used to someone they do not know. The best approach is to ignore them initially and to focus on talking to the parents. The child will likely resist being held by a stranger, so the nurse should not pick up or hold the child until the child indicates a readiness to be approached or the mother indicates that it is okay. After insertion of bilateral tympanostomy tubes in a toddler, which of the following instructions should the nurse include in the child's discharge plan for the parents? 1. Insert earplugs into the canals when the child bathes. 2. Blow the nose forcibly during a cold. 3. Administer the prescribed antibiotic while the tubes are in place. 4. Disregard any drainage from the ear after 1 week. The correct answer is 1. Placing earplugs in the ears will prevent contaminated bathwater from entering the middle ear through the tympanostomy tube and causing an infection. Blowing the nose forcibly during a cold causes organisms to ascend to the eustachian tube, possibly leading to otitis media. It is not necessary to administer antibiotics continuously to a child with a tympanostomy tube. Antibiotics are appropriate only when an ear infection is present. Drainage from the ear may be a sign of middle ear infection and should be reported to the healthcare provider. After teaching the parents of a toddler about commonly aspirated foods, which of the following foods, if identified by the parents as easily aspirated, would indicate the need for additional teaching? 1. Popcorn. 2. Raw vegetables. 3. Round candy. 4. Crackers. The correct answer is 4. Crackers, because they crumble and easily dissolve, are not commonly aspirated. Because children commonly eat popcorn hulls or pieces that have not popped, popcorn can be easily aspirated. Toddlers frequently do not chew their food well, making raw vegetables a commonly aspirated food. Round candy is often difficult to chew and comes in large pieces, making it easily aspirated. A toddler who has been treated for a foreign body aspiration begins to fuss and cry when the parents attempt to leave the hospital for an hour. The parents will be returning to take the toddler home. As the nurse tries to take the child out of the crib, the child pushes the nurse away. The nurse interprets this behavior as indicating separation anxiety, involving which of the following? 1. Protest. 2. Despair. 3. Regression. 4. Detachment. The correct answer is 1. Young children have specific reactions to separation and hospitalization. In the protest stage, the toddler physically and verbally attacks anyone who attempts to provide care. Here, the child is fussing and crying and visibly pushes the nurse away. In the despair stage, the toddler becomes withdrawn and obviously depressed. Regression is a return to a developmentally earlier phase because of stress or crisis. Denial or detachment occurs if the toddlers stay in the hospital without the parent is prolonged because the toddler settles into the hospital life and denies the parent's existence. After teaching the parents of an 18-month-old who was treated for a foreign body obstruction about the 3 cardinal signs indicative of choking, The nurse determines that the teaching has been successful when the parents state that a child is choking when he or she cannot speak, turns blue, and does which of the following? 1. Vomits. 2. Gasps. 3. Gags. 4. Collapses. The correct answer is 4. The 3 cardinal signs indicating that a child is truly choking and requires immediate life-saving interventions include inability to speak, blue color, and collapse. Vomiting does not occur while a child is unable to breathe. Once the object is dislodged, however, vomiting may occur. Gasping, a sudden intake of air, indicates that the child is still able to inhale. When a child is choking, air is not being exchanged, so gagging will not occur. The father of a 2-year-old phones the emergency room on a Sunday evening and informs a nurse that his son put a bead in his nose. What is the most appropriate recommendation made by the nurse? 1. Try to remove the bead at home as soon as possible. You might try using a pair of tweezers. 2. Be sure to take your child to the pediatrician in the morning so the pediatrician can remove the bead in the office. 3. You should bring your child to the emergency room tonight so the bead can be removed as soon as possible. 4. Ask your child to blow his nose several times. This should dislodge the bead. The correct answer is 3. The bead should be removed by a healthcare professional as soon as possible to prevent the risk of aspiration and tissue necrosis. Unskilled individuals should not attempt to remove an object from the nose, as they may push the object further, increasing the risk for aspiration. 2-year-old children are not skilled at blowing their nose and may breathe in, further increasing the risk of aspiration. A multigravida client at 32 weeks gestation has experienced hemolytic disease of the newborn in a previous pregnancy. The nurse should prepare the client for frequent antibody titer evaluations obtained from which of the following? 1. Placental blood. 2. Amniotic fluid. 3. Fetal blood. 4. Maternal blood. The correct answer is 4. For the Rh-negative client who may be pregnant with an Rh-positive fetus, an indirect Coombs test measures antibodies in the maternal blood. Titers should be performed monthly during the first and second trimesters, and biweekly during the third trimester and the week before the due date. A client with a past medical history of ventricular septal defect repaired in infancy is seen at the prenatal clinic. She has dyspnea with exertion and is very tired. Her vital signs are temperature, 98.0 degrees Fahrenheit, pulse, 80 beats per minute, respiration, 20 breaths per minute, and blood pressure 116/72. She has +2 pedal edema and clear breath sounds. As the nurse plans this client's care, which of the following is her cardiac functional classification? 1. Class 1. 2. Class 2. 3. Class 3. 4. Class 4. The correct answer is 2. According to both the New York Heart Association and the Canadian Cardiovascular Society, this client would fit under Class 2 because she is symptomatic with increased activity, which is dyspnea with exertion. Class 2 clients have cardiac disease and a slight limitation in physical activity. When physical activity occurs, the client may experience angina, difficulty breathing, palpitations, and fatigue. All of the client's other symptoms are within normal limits. A premigravida client has completed her first prenatal visit and blood work. Her laboratory test for the hepatitis B surface antigen is positive. The nurse can advise the client that the plan of care for this newborn will include which of the following? Select all that apply. 1. Hepatitis B immune globulin at birth. 2. Series of 3 hepatitis B vaccinations per recommended schedule. 3. Hepatitis B screening when born. 4. Isolation of infant during hospitalization. 5. Universal precautions for mother and infant. 6. Contraindication for breastfeeding. The correct answers are 1, 2, and 5. The test result indicates that the mother has an active hepatitis infection and is a carrier. Hepatitis B immune globulin at birth provides the infant with passive immunity against hepatitis B and serves as a prophylactic treatment. Additionally, the infant will be started on the vaccine series of 3 injections. The infant should not be screened or isolated because the infant is already hepatitis B positive. As with all clients, universal precautions should be used and are sufficient to prevent transmission of the virus. Women who are positive for hepatitis B surface antigen are able to breastfeed. A woman with asthma controlled through consistent use of medication is now pregnant for the first time. Which of the following client statements concerning asthma during pregnancy indicates the need for further instruction? 1. I need to continue taking my asthma medication as prescribed. 2. It is my goal to prevent or limit asthma attacks. 3. During an asthma attack, oxygen needs to continue to be high for mother and fetus. 4. Bronchodilators should be used only when necessary because of the risk they present to the fetus. The correct answer is 4. Asthma medications and bronchodilators should be continued during pregnancy as prescribed before the pregnancy began. The medications do not cause harm to the mother or fetus. Regular use of asthma medication will usually prevent asthma attacks. Prevention and limitation of an asthma attack is the goal of care for a client who is or is not pregnant and is the appropriate care strategy. During an asthma attack, oxygen needs continue as with any pregnant client, but the airways are edematous, decreasing perfusion. Asthma exacerbations during pregnancy may occur as a result of infrequent use of medication rather than as a result of the pregnancy. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A woman at 22 weeks gestation has right upper quadrant pain radiating to her back. She rates the pain as 9 on a scale of 1 to 10 and says that it has occurred 2 times in the last week for about 4 hours at a time. She does not associate the pain with food. Which of the following nursing measures is the highest priority for this client? 1. Educate the client concerning changes occurring in the gallbladder as a result of pregnancy. 2. Refer the client to her healthcare provider for evaluation and treatment of the pain. 3. Discuss nutritional strategies to decrease the possibility of heartburn. 4. Support the client's use of acetaminophen to relieve pain. The correct answer is 2. The nurse seeing this client should refer her to a healthcare provider for further evaluation of the pain. This referral would allow a more definitive diagnosis and medical interventions that may include surgery. Referral would occur because of her high pain rating, as well as the other symptoms, which suggest gallbladder disease. During pregnancy, the gallbladder is under the influence of progesterone, which is a smooth muscle relaxant. Because bile does not move through the system as quickly during pregnancy, bile stasis and gallstone formation can occur. Although education should be a continuous strategy, with pain at this level, a brief explanation is most appropriate. Major emphasis should be placed on determining the cause and treating the pain. It is not appropriate for the nurse to diagnose pain at this level as heartburn. Discussing nutritional strategies to prevent heartburn are appropriate during pregnancy, but not in this situation. Tylenol is an acceptable medication to take during pregnancy, but should not be used on a regular basis, as it can mask other problems. A client in the triage area, who is at 19 weeks gestation, states that she has not felt her baby move in the past week, and no fetal heart tones are found. While evaluating this client, the nurse identifies her as being at the highest risk for developing which problem? 1. Abruptio placentae. 2. Placenta previa. 3. Disseminated intravascular coagulation. 4. Threatened abortion. The correct answer is 3. A fetus that has died and is retained in utero places the mother at risk for disseminated intravascular coagulation because the clotting factors within the maternal system are consumed when the non-viable fetus is retained. The longer the fetus is retained in utero, the greater the risk of DIC. This client has no risk factors, history, or signs and symptoms that put her at risk for either abruptio placentae or placenta previa, such as sharp pain and woody, firm consistency of the abdomen, or painless bright red vaginal bleeding. There is no evidence that she is threatening to abort as she has no cramping or vaginal bleeding. A 40-year-old client at 8 weeks gestation has a 3-year-old child with Down syndrome. The nurse is discussing amniocentesis and chorionic villus sampling as genetic screening methods for the expected baby. The nurse is confident that the teaching has been understood when the client states which of the following? 1. Each test identifies a different part of the infant's genetic makeup. 2. Chorionic villus sampling can be performed earlier in pregnancy. 3. The test results take the same length of time to be completed. 4. Amniocentesis is a more dangerous procedure for the fetus. The correct answer is 2. Chorionic villus sampling can be performed from approximately 8 to 12 weeks gestation, while amniocentesis cannot be performed until between 11 weeks gestation and the end of the pregnancy. 11 weeks gestation is the earliest possible time within the pregnancy to obtain a sufficient amount of amniotic fluid to sample. Because CVS take a piece of membrane surrounding the infant, this procedure can be completed earlier in the pregnancy. Amniocentesis and chorionic villus sampling identify the genetic makeup of the fetus in its entirety, rather than a portion of it. Laboratory analysis of chorionic villus sampling takes less time to complete. Both procedures place the fetus at risk, and post-procedure teaching asks the client to report the same complicating events, such as bleeding, cramping, fever, and fluid leakage from the vagina. After conducting a presentation to a group of adolescent parents on the topic of adolescent pregnancy, the nurse determines that one of the parents needs further instruction when the parent says that adolescents are at greater risk for which of the following? 1. Denial of the pregnancy. 2. Low birth weight infant. 3. Cephalopelvic disproportion. 4. Congenital anomalies. The correct answer is 4. Additional teaching is needed when the parent says that adolescents are at greater risk for congenital anomalies. Although adolescents are at greater risk for denial of the pregnancy, lack of prenatal care, low birth weight infant, cephalopelvic disproportion, anemia, and nutritional deficits, and have a higher maternal mortality rate, studies reveal that congenital anomalies are not more common in adolescent pregnancies. A dilatation and curettage is scheduled for a preemie gravida client admitted to the hospital at 10 weeks gestation with abdominal cramping, bright red vaginal spotting, and passage of some of the product of conception. The nurse should assess the client further for the expression of which of the following feelings? 1. Ambivalence. 2. Anxiety. 3. Fear. 4. Guilt. The correct answer is 4. With a spontaneous abortion, many clients and their partners feel an acute sense of loss. Their grieving commonly includes feelings of guilt, which may be expressed as wondering whether the woman could have done something to prevent the loss. Anger, sadness, and disappointment are also common emotions after a pregnancy loss. Ambivalence, anxiety, and fear are not common emotions after a spontaneous abortion. When providing care to the client who has undergone a dilatation and curettage after a spontaneous abortion, the nurse administers hydroxyzine as prescribed. Which of the following is an expected outcome? 1. Absence of nausea. 2. Minimized pain. 3. Decreased uterine cramping. 4. Improved uterine contractility. The correct answer is 1. Hydroxyzine has a tranquilizing effect and also decreases nausea and vomiting. It does not decrease fluid retention, reduce pain, decrease uterine cramping, or promote uterine contractility. One of the adverse effects of the medication is sleepiness. Ibuprofen may decrease pain from uterine cramping. Oxytocin may be used to increase uterine contractility. On entering the room of a client who has undergone a dilatation and curettage for a spontaneous abortion, the nurse finds the client crying. Which of the following comments by the nurse would be most appropriate? 1. Are you having a great deal of uterine pain? 2. Commonly spontaneous abortion means a defective embryo. 3. I'm truly sorry you lost your baby. 4. You should try to get pregnant again as soon as possible. The correct answer is 3. The death of a fetus at any time during pregnancy is a tragedy for most parents. After a spontaneous abortion, the client and family members can be expected to suffer from grief for several months or longer. When offering support, a simple statement such as, "I'm truly sorry you lost your baby," is most appropriate. Therapeutic communication techniques help the client and family understand the meaning of the loss, move less stressfully through the grief process, and share feelings. Asking the client whether she is experiencing a great deal of uterine pain is inappropriate because this is a yes or no question and doesn't allow the client to express her feelings. Saying that the embryo was defective is inappropriate because this may lead the client to think that she contributed to the fetus's demise. This is not the appropriate time to discuss embryonic or fetal malformations. However, the nurse should explain to the client that this situation was not her fault. Telling the client that she should get pregnant again as soon as possible is not therapeutic and discounts the feelings of the expectant mother who had already begun to bond with the fetus. RhoGAM is prescribed for a client before she is discharged after a spontaneous abortion. The nurse instructs the client that this drug is used to prevent which of the following? 1. Development of a future Rh-positive fetus. 2. An antibody response to Rh-negative blood. 3. A future pregnancy resulting in abortion. 4. Development of Rh-positive antibodies. The correct answer is 4. Rh sensitization can be prevented by RhoGAM, which clears the maternal circulation of Rh-positive cells before sensitization can occur, thereby blocking maternal antibody production to Rh-positive cells. Administration of this drug will not prevent future Rh-positive fetuses, nor will it prevent future abortions. An antibody response will not occur to Rh-negative cells. Rh-negative mothers do not develop sensitivities if the fetus is also Rh-negative. A multigravida client who stand for long periods while working in a factory visits the prenatal clinic at 35 weeks gestation, stating, "The varicose veins in my legs have really been bothering me lately. Which of the following instructions would be helpful? 1. Perform slow contraction and relaxation of the feet and ankles twice daily. 2. Take frequent rest periods with the legs elevated above the hips. 3. Avoid support holds that reach above the leg varicosities. 4. Take a leave of absence from your job to avoid prolonged standing." The correct answer is 2. The client with leg varicosities should take frequent rest periods with the legs elevated above the hips to promote venous circulation. The client should avoid constrictive clothing, but support hose that reach above the varicosities may help alleviate the pain. Contracting and relaxing the feet and ankles twice daily is not helpful because it does not promote circulation. Taking a leave of absence from work may not be possible because of economic reasons. The client should try to rest with her legs elevated or walk around for a few minutes every 2 hours while on the job. While caring for a 24-year-old preemie-gravida client scheduled for emergency surgery because of a probable ectopic pregnancy, the nurse should 1. Prepare to witness and inform consent for surgery. 2. Assess the client for massive external bleeding. 3. Explain that the fallopian tube can be salvaged. 4. Monitor the client for uterine contractions. The correct answer is 1. The client may need surgery to remove a ruptured fallopian tube where the pregnancy has occurred, and the nurse is usually responsible for witnessing the signature on informed consent. Typically, if bleeding is occurring, it is internal, and there is only scant vaginal bleeding with no discoloration. The nurse cannot determine whether the fallopian tube can be salvaged. This can be accomplished only during surgery. If the tube has ruptured, it must be removed. If the tube has not ruptured, a linear salpingostomy may be done to salvage the tube for future pregnancies. With an ectopic pregnancy, although the client is experiencing abdominal pain, she is not having uterine contractions. A client comes to mental health clinic saying that he feels so down and lacking in energy with loss of interest in everything. He tells the nurse that he received some samples of a new medication from his primary care physician last week to relieve his depression. The nurse recalls that this client has a history of bipolar 1 disorder with hospitalization for a significant manic episode. With this knowledge, the nurse would have special concern if he is taking which of the following categories of medication? 1. Atypical antipsychotics. 2. Mood stabilizers / animatics. 3. Anti-anxiety agents. 4. selective serotonin reuptake inhibitor antidepressant. The correct answer is 4. The most urgent consideration for intervention and for teaching is the fact that for individuals with a history of bipolar disorder, antidepressants, when taken alone, can push the person into mania. Antipsychotics are sometimes prescribed for clients with bipolar disorder and would not pose a special concern. Individuals with bipolar disorder are typically treated with mood stabilizers, and benzodiazepines are sometimes used in the short term to give a client relief before the mood stabilizers can take effect. In a pre-discharge program to educate clients with bipolar disorder and their family members, the nurse emphasizes that the most significant indicators for the onset of relapse include which of the following symptoms? 1. A sense of pleasure and motivation for new endeavors. 2. Decreased need for sleep and racing thoughts. 3. Self-concern about increase in energy. 4. Leaving a good job to start a new business. The correct answer is 2. Decreased need for sleep and racing thoughts are the most prominent hallmarks of mania. Feelings of pleasure, motivation, and increased energy within reason are desired experiences. Also, leaving a job to start a new business is not, in itself, a sign of impending illness. A client has just been admitted to the hospital for medication adjustment after outpatient treatment failure of his bipolar disorder and returning mania. He tells his primary nurse about his medications and treatment. Which of his following statements would raise the most urgent need for more medication instruction about his lithium therapy? 1. My doctor tells me that my lithium level is 1.0, so I don't have to worry about my levels. 2. I've been getting a lot of good exercise playing on a local soccer team. 3. I'm trying hard to watch my diet and eat healthy. 4. I have learned to take my lithium even when I'm not feeling well, like when I had the stomach flu. The correct answer is 4. The therapeutic serum level for lithium is 0.6 to 1.2 milliequivalents per liter. Levels do fluctuate with fluid intake and output, however. Therefore, the most urgent matter for teaching is the client's comment about taking his lithium during excessive loss of fluids during an episode of stomach flu with diarrhea. Exercising is only concerning if the client becomes dehydrated. A healthy diet is indicated while taking lithium. A young woman comes to the mental health clinic for her routine medication follow-up. She has been married for 2 years and reports that she and her husband are ready to start a family. She has a diagnosis of bipolar 1 disorder and has been well managed on D-valproic sodium Depakote for at least 3 years. What is the most essential counsel for the nurse to give her? 1. Schedule an appointment for a complete gynecological exam if you have not had one in the past year. 2. Pay careful attention to eating healthy from this point on in order to maximize the health of both mother and baby. 3. Check with your prescriber today as Depakote carries an increased risk for birth defects, especially during the first 3 months of pregnancy. 4. It is very important for you to take steps to reduce your stress, and this will help you to stay in balance during your pregnancy and reduce your chances of developing postpartum depression. The correct answer is 3. All of these options need to be addressed. However, it is vital that this young woman receive counseling about the serious birth defects that have an increased incidence with the taking of Depakote during the first trimester of pregnancy. These problems include craniofacial abnormalities, organ malformations, limb deficiencies, and developmental delays. The chances of preeclampsia and premature labor are also increased. A healthcare provider has prescribed valproic acid for a client with bipolar disorder who has achieved limited success with lithium carbonate. The nurse should instruct the client about which of the following? 1. Follow-up blood tests are necessary while on this medication. 2. The extended release tablet can be crushed if necessary for ease of swallowing. 3. Tachycardia and upset stomach are common side effects. 4. Consumption of a moderate amount of alcohol is safe if the medication is taken in the morning. The correct answer is 1. Valproic acid can cause hepatotoxicity, so regular liver function tests are needed. Other side effects include nausea and drowsiness. Extended release tablets should not be split or crushed. Doing so changes their absorption. Alcohol should never be mixed with this medication. There will be medication in the client's body at all times. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A young adult client diagnosed with bipolar disorder has been managing disorder effectively with medication and treatment for several years. The client suddenly becomes manic. The nurse reviews the client's medication record. Which of the following medications may have contributed to the development of his manic state? 1. Amitriptyline. 2. Prednisone. 3. Buspirone. 4. Gabapentin. The correct answer is 2. The use of prednisone or other steroids can initiate a manic state in a bipolar client, even if he is well controlled on medication. The other medications would decrease the client's depression, mood swings, and anxiety, making him calmer rather than more agitated. The client with acute mania has been admitted to the inpatient unit voluntarily. The nurse approaches the client with medication to be taken orally as prescribed by the primary health care provider. The client states, "I don't need that stuff," which responds by the nurse's best. 1. You can't refuse to take this medication. 2. If you don't take it orally, I'll give you a shot. 3. The medication will help you feel calmer. 4. I'll get you some written information about the medication. The correct answer is 3. The nurse should first attempt a collaborative approach to increasing adherence to prescribed medication regimen. Giving written medication information to a client with acute mania is poor nursing judgment, because a client with acute mania cannot benefit from written information as a result of impaired ability to focus and concentrate. A nurse observes a male client who is hyperactive and intrusive, sitting very close to a female client with his arm around her shoulders. The nurse hears the male client tell an inappropriate joke. The nurse approaches the client and asks him to walk down the hallway. Which of the following statements by the nurse should benefit the client? 1. She will not want to be around you with that kind of talk. 2. Telling inappropriate jokes and touching others is not permitted here. 3. You need to be careful about what you say to other people. 4. I think a timeout in your room would be appropriate now. The correct answer is 2. The nurse clearly informs the client about behavior that is unacceptable on the unit, such as voicing inappropriate jokes and touching others. Setting limits on behavior provides safety and security to the client and conveys to the client that he is worthy of help. Saying, "She will not want to be around you with that kind of talk, and you need to be careful about what you say to others," does not clearly inform the client about behaviors that are unacceptable and implies that the client can control behaviors if he chooses. A timeout in the client's room does not inform the client about the inappropriateness of his behaviors and could be interpreted by the client as punitive as well as diminishing his self-esteem. A client states to a nurse, "Hey, sweetie, you're looking good today." Which of the following responses by the nurse is best? 1. Thank you for being so kind and thoughtful. 2. I know you are only teasing me. 3. My name is Molly and I am a nurse on a unit today. 4. I am not here to receive compliments from clients. The correct answer is 3. The nurse states her identity and purpose for being on the unit to clarify any misperception by the client. Thank you for being so kind. I know you are only teasing me, and I am not here to receive compliment from clients are non-therapeutic statements and do not clarify the nurse's identity and purpose. A client with acute mania fails to respond to a nurse's interventions to decrease his agitation. The nurse has attempted to defuse the client's anger, but the client refuses to participate in interventions that would lower anxiety. Which action should the nurse take next? 1. Seclude the client. 2. Restrain the client. 3. Medicate the client. 4. Control the client. The correct answer is 3. The nurse should medicate the client who does not respond to verbal interventions and whose anxiety is escalating. This will reduce the client's anxiety and agitation and prevent harm or injury to the client and others. Seclusion, restraint, and controlling the client are a last resort and require a primary healthcare provider prescription and close assessment for when the prescriptions can be discontinued. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.